I'm getting there. You're good.
Did I start too early? I'm sorry.
No, you're
Go
good.
back and retrace myself.
You're good.
Okay.
Shit.
I have a very informal teaching style too, so you guys can actually close your books. We're gonna get up and stand up, and I'm gonna need to. You guys all have hoodies on.
Hey, Glenn, can you hear all right?
Yeah, we'll probably use those. Oh, welcome back.
I can hear you, Jim.
Yeah, because Tanner's kind of long and winky. It's perfect.
Okay.
So, what are we talking about tonight? You guys know what chapter you're on? What chapter you guys are doing tonight? 10? I don't have your books. I don't know what chapter it is. What is it? Respirations. So, what's the difference between airway and respirations? No. I don't have a shirt on. You don't? No.
Respiration and artificial ventilation.
Oh, respirations. It's fine. You're fine. We'll just I'll use her. So, respirations and ventilations. What's the difference between airway and respiration? Yeah, airway is like the actual anatomy. Respirations is more the physiology and how everything works together. So, what do you guys know about breathing? You need to do it. Yeah, you have to do it. If you think of your life as a 2-minute cycle, you will die in 2 minutes. And every time you take a breath, that resets. That's how I figure breathing out. I have 2 minutes until I die. Well, no, start over. Respirations are, but there's more to respirations than just breathing and taking it. There's the actual like piece where your cells need oxygen, where you have to shift carbon dioxide out of your blood. You guys know that we do that, right? You know, we breathe in oxygen and out comes CO2. But how does that process work? So have you guys already done airway? A couple nights ago. So what's the important piece in respirations that's also from airway anatomy? What is the most important little thing in the lungs where all of that stuff is? You say it like a question, but you know the answer, just say it. What's that? Yeah, right? Alveoli. What are those? Perfect timing. Come on up. So you're my demonstrator and you're going to draw.
Oh.
Okay. No, she's going to draw. So everybody come on up. Like I said, I'm a very informal teacher. Go ahead, lay down. Lay down.
Hop on there, Casey.
Yeah, roll over. All right, so we're talking about respiration, right? So where is that body system located? Where's our airway and all that stuff at?
Like here to here.
Yeah, so we want to get from about right here on her to the top of her head. So trace around her.
Okay.
You like, you know, you did the little 5-year-old project where you trace her hand?
Hand.
Do the same thing with from about her hips all the way up around her head. Arms up. Make them weird. Okay, yeah, come on over here. How's it going?
It's going.
We are just getting into class. So perfect
Welcome.
timing.
It's just echo.
You don't really need to run.
Huh?
You don't really need to run.
No. You know, I just said make a mirror. Try it out. Maybe I could use one. Oh, ripping the chat my hair. Thanks, Danny. Okay.
Hope you like it.
Not particularly, but
No, let's do that.
it's okay. It's extra. That was not a straight line also, but I was.
Okay, roll over.
Yeah.
There we go. Okay, now fill it in. So go ahead and fill in our shoulder right here.
Give me a whole arm, Danny, not just part. Hey, I don't think my arms look like that.
Okay, so we've got our mouth. What's next? Working down physiology or the anatomy of the airway. What's next? Oropharynx. Oropharynx. Yeah, so how far down does the oropharynx go? Where does it stop?
The larynx.
That's up to the larynx. So the larynx is actually about right here. So that's where you split between the trachea and the esophagus. Really, you just have one big hole and it splits into two, and that's where everything comes apart. Okay? Yeah. But what's below that? Epiglottis. We're not going that deep. Trachea. How far down is the trachea? What's that? To your lungs.
Oh, you have a
Where
baby.
where are the lungs at?
Chest cavity.
Your chest cavity, right? But where are they actually at? So if we used her as a demonstrator, where do her lungs start? Where do they end? go with her shoulder. This is like the shoulder muscle. And here's her clavicle. So we have some anatomical things on the outside of the body that we know where the actual open space is called. What do we call that open space in the chest? Pleural space. It is just a big opening, right? So in this opening,
Yeah.
that's all right.
It's not doing
You got a
so
heart
well.
here, there's stuff there, okay? What's important about these structures? You need them to live, yes. What else? What do the lungs do? What is their job?
Take oxygen and put it in the blood.
It puts it, how does it put it into the blood? Well, the alveoli are where they collect oxygen. They kind of grab it up.
Yeah.
So we put it into our lungs through here. So what side, sorry, let's get back to the trachea. What side goes straight? What side goes angled?
Left side goes angled, right side goes straight.
Why do you say that?
Because it has to go around the heart.
So the heart's here. This is like your aortic notch and your pulmonary artery, all this stuff there, and all this crap in the back. So not to get too deep on you guys, but always think of right stem will go more into the right side. Right side has 3, left side has 2, right? Because this is north. So what other pieces of anatomy matter for here? We got deep into the alveoli, and we're getting a little bit too far ahead of ourselves.
Okay.
What else matters? You're on the right track. Don't worry, they all said it too. What else matters here? What's important?
Open airway.
Open airway, kind of. We're still talking about anatomy, actual body parts.
Bronchi.
Okay.
And then the bronchioles.
What else? We're
We're
missing one very big, very important thing.
capillaries.
Take a guess. What makes you breathe?
Your diagram?
Why does that make you breathe?
Yeah, those ones aren't
Yeah,
very
when-
start stable.
So pressure, explain that.
That was a briefly read paragraph in the book.
You're
But,
fine. Hey,
uh,
so and just so all you guys know, I heard that Sheriff said that I like to talk and get deep into things.
I think her
But
exact
we're
words was
here-
that you could touch a book and it would go through your
Yeah.
fingertips up your arm and into your
I
head.
do believe.
If I remember
Awesome.
right.
Awesome.
So I know we've talked about the different pressures for breathing,
Yeah,
correct?
It makes a negative pressure system.
it is.
Yeah.
What do you mean negative pressure?
Uh,
And so a little disclaimer, you guys are not wrong.
Mhm.
Okay, we're teaching. So if you guys have guesses, say them. I'm not gonna tell you you're stupid, or that you got it wrong. This is not how this works. To teach you, you guys have to understand how things work. So I will not make fun of you. I don't know about Tanner or Jim, but
Tanner absolutely.
I know Jim will be like, no.
You and I.
It depends on what you say.
Yeah,
I mean, there are stupid
This exact
questions and there are
topic.
stupid statements,
there are.
but
And that's how you divert and
Yeah.
say, wow, thank you for that loss of a few minutes, but let's get back to what we were talking about.
as long
May
as,
God have mercy on you.
Yeah.
as long as you stay on point and on topic, there are no stupid questions or
Yeah.
answers.
So I will not make fun of you guys for just saying answers. That's like you said alveoli really quiet earlier. Say it. Say what's on your mind. Most of the time, you're probably leading in the right area. Okay? So you talk pressure, you said negative pressure. What does that mean?
We breathe in. I have to think about how this.
When you breathe in, your diaphragm goes up.
Does it go up?
Nope,
Goes
it,
down, it has to.
it contracts, which creates a negative pressure vacuum that pulls the air into the lungs.
Yeah, it pulls air. We're not forcing air in by breathing and sucking air in, it's our diaphragm actually sucking down towards our stomach, past past where it normally goes. That is actually your diaphragm flexing. So it is contracting and squeezing down. So when you squeeze like something, or you do a bicep curl in the gym, you're squeezing up, your bicep is doing the work. Every time you take a breath, your diaphragm is doing the same thing. So how does it relax? What happens then?
It pushes on the lungs, push the air out.
Not necessarily pushing, it just relaxes, and all of that negative pressure, all that pressure just changes and it goes away. And it comes back. Yeah, it just comes back. So here we are, we're up and down like this, right? So, I had a thing for babies. I'm okay to hold them if you want to get down and draw stuff, like, no issue with that. Actually, you haven't drawn yet.
Come on, Brianna.
Come on, over
You
here.
got it.
Over here.
Part of the crew, part of the show.
Yeah. Okay, so we've talked a little bit about pressure, we've talked a lot about anatomy, but we're past anatomy. Now we need to get into how things work together. Can you draw me, just off the body, an alveoli bundle?
Can't draw that sound, but I can look at it.
That's close enough. If you want to sit down, like, there's plenty of chairs.
I'm good with standing.
Okay. All right, what else is in an alveolar bundle? Alveolar,
The capillaries.
right? So we have two sides to that. Pretty much, that's a really, really simple way to describe it. It looks like a flower, but what else is there? The capillaries. How do they go? Where do they sit? You know? What is a capillary? You know?
It's where the vein arteries exchange oxygen and CO2.
You were saying something?
Tiny blood vessels.
Tiny blood vessels. Everywhere in your body has capillaries. And he said that's where they exchange. This is the exchange point right here. So they are really, really small tubes. You draw some really small tubes. So draw one tube coming up to it and it kind of splitting around all of them. Like a spider web. Yep. I just kidding. Go ahead.
No, okay.
It's like one, okay, I don't know what you're going.
You're fine. Just keep going.
Think of the vessel that's bringing the blood to it, then how it would conform around it, and then the blood away from it.
You're not wrong. Just keep going.
It's a little far away.
You're fine.
Going to it and then, or like branch out off of that? And then would it branch to all of them off of that singular one?
It would. What? Why?
I don't know.
What did I just tell you?
I got real hot.
How you think about how this is working. So you got to think of where the exchange is happening. I want you guys to think through this process. Does it look like broccoli?
So would it branch off of like would it come off of here to the other ones or would it come off of the main?
What do you think? What would make more sense?
To me, it makes sense for it to branch off of the ones that are already out there.
So think of this as blood coming through here. So we have deoxygenated blood here and oxygenated here. Here's our spotting point. Okay. And then it goes over here. It's all over. It covers the whole thing and it just wraps around like a spider web. It keeps these things covered. So these things, for the alveoli, open. They bring in oxygen. Blood comes across through these tubes. And they all join back up into one. So each alveolar bundle looks like that. It's a bunch of bubbles with a spider web of capillaries around it. Why is that important? Why am I showing you guys this? You have a cat.
It's starting to smell.
Why is this important? Are we spending 15 minutes on this?
Because if we don't breathe in our CO2 levels rise,
We do. Why does that matter?
the blood isn't getting oxygenated.
What is CO2 control? Wait, Tanner,
Put your hand down.
just hold on. They're already trained. Let them think through it. What does CO2 actually do for our body? Go ahead, Tanner.
Controls your respiratory drive.
Respiratory drive. What is that?
How much your body forces respirations.
It's your body's desire to breathe. So if I have a lot of CO2, am I breathing really fast or a lot? If I have no CO2, am I breathing really fast and a lot? No. So you guys see the difference, right? You have these really cool sensors in your body, these receptors that read how much CO2 you have. They're in a couple cool places, and they're right by the heart and the lungs. If they sense a lot of CO2, hey, we breathe fast. What's the normal rate for human or adults? 12 to 20. If I'm breathing at 20 and I'm looking at you, I'm breathing at 20. Am I breathing fast? Is that fast? Would you guess?
Seem fast.
It would seem fast. So you're already keyed in on what? I'm having a breathing issue. You know that just by looking. I haven't even said it. You can see how fast I'm breathing. So we talk like assessment. Hey, just looking at your patient, I can see that you're breathing at like 40 times a second or 40 times a minute. That's really freaking fast. 40 times a second. That's really fast. I know that they've got some issues going on with their lungs. They've got some issues going on with the swapping of O2 to CO2. Does that make sense? This matters for that. This, we can get a reading on just by looking at how you're breathing. That makes sense? Just want to take a 5-minute break. See this. What? No, you have a question? Or are you trying to hide back and go on?
Yeah, I'm good.
Yeah, I think we're good.
Okay, all right. So we talked a little bit about assessment, but right here, if I know that they're having a problem here, yeah, I know they're having an issue right here. What kind of issues? Have they gone over signs and symptoms or like disease process?
Not yet.
No? Okay.
A
So
little bit.
what would
Tough
stop
physiologist should have went through a little bit.
a little bit? So what would stop the shift of oxygen and CO2 right here? If something was blocking it, right? What if we weren't able to take in oxygen? Or these have shut down. So how do these shut down? What do you think? Yes.
Are they something that can be like injured?
Smoking. Smoking causes what's called atelectasis. That means that they are dying. These little things are dying and they die. You guys see the black lungs, right? That's a severe case of atelectasis. That takes a very, very long time to get to. But a little bit of smoking can cause the death of alveoli. So when you have a little bit of death, that changes your absorption rate of oxygen and your transfusion of CO2. Okay, so I'm talking about something that was listed in the slides quite a bit. It's called a BQ mismatch. Anybody heard that term? Tanner, what is it?
Volume and quality mismatch.
Not quite.
It's ventilation and respiration mismatch.
Ventilation and perfusion.
Perfusion.
What is perfusion? Can you tell me? You've actually been talking about it quite a bit.
the ability to.
What's that?
I was telling him, well, we were just reading about that,
DQ mismatch?
and one of my other things.
The ability to push oxygenated blood to the extremities.
To everywhere.
To everywhere.
Yeah, not everywhere. So what do we treat every patient for really? Do you know?
For perfusion.
Poor perfusion, what is that called though? What's the medical term?
Shock.
Shock. Every person gets treated for shock. How do we treat people for shock? We treat them with oxygen. We keep them warm. Is there anything else we do? What's the most simplest airway intervention we can do?
General cycle.
Basic, even more basic than that. Talk to them,
Yeah,
conversation.
make sure they're always open.
Yeah, they got a face mask on. I'm just gonna talk to them. How are you guys sitting right now? Is that comfortable? No? Say no? You're in a little pain? We provide that, we let them sit in a position of comfort. Any sort of position that they have that we know is gonna help them breathe better. It's gonna help them take away pain, okay? So here, position of comfort, either for heat or cold, and providing oxygen helps us fix these little things. Okay, now let's take 5 minutes. I can tell you guys are rough, having a hard time. You guys been at work all day, like been at school, how old are you?
I'm homeschooled, so I was at work all day.
Okay, same thing.
You started scooters already?
Yeah, we started last week.
Scooters? What scooters?
Coffee shop.
Oh,
The new coffee shop.
Scoot on,
that lives on Maverick.
yeah, take 5 minutes,
To go
you
there
drink,
tomorrow. I saw AJ.
Stand up.
Taco John's, he says they have a really good protein treat.
We
Huh?
do. A
The
peanut butter
peanut-
power? Yummy.
He said it's phenomenal.
Yeah.
I'm gonna have to go by tomorrow. and try it.
I'm not from around here if you guys didn't know. I hope Cheryl gave a little bit of an introduction for me last night. Outside of apparently I can touch a book and know it.
Yeah, a lot of it was centered around how you.
To be fair, Greg,
Yeah.
Yeah, I'm
Crazy.
really bad about talking.
Well, so far, I like the teaching style.
Yeah,
I,
me too.
like,
Yeah,
I'm
gonna, that's what I was gonna
retain this
say,
a
much more.
slides.
That's good.
It's terrible.
There's some things that we can't get away from being
Mhm.
boring about.
Yeah.
There's other things that we can get away from being boring about.
That's what we talked about last time,
Yeah.
before we left.
Yeah.
that's why I was a
Was like,
little
what was
upset actually, because JJ said I'm not allowed to teach the stuff I taught last year. But I have like a lot more stuff for that stuff. And so I'm like, man, I think kind of want to.
What did you teach last time?
A lot of it was towards the end of the class, like your hazmat stuff, apparently Cole said's gonna come do that. You're not gonna be here to help, so I'll still help him.
Why does
There's,
poor Glenn miss out on all the
like-
cool things? Yeah, what? Poor guy.
I don't know, ask him,
Environmental emergencies.
I texted him to ask him if he was still dying.
ask him.
No, 'cause I
He's lying
messaged.
about
He's
this.
probably listening.
Yeah.
Listen,
He
we
goes,
talked to you about it.
Glenny, he goes, I did die.
I have a lot more on the environmental emergencies.
He's with us in spirit. Rip.
I was
Does
like,
he-
yeah,
does
he
he
have
have-
signed up,
Plenty.
I'll do that. And
Did you have any
JJ was like,
questions?
taught that last year, you can't teach it this year. I was like, that's stupid.
Good chat, Glenn.
Glenn, you there?
You there? You awake?
Yeah, I'm here, guys.
Okay.
Check in.
Well, the girls are talking crap about you.
No, we're not.
Can
I
you
can't imagine.
see everything?
Actually wanted to get really messed up. So they gave me that one.
Is this thing even working?
Is the mic working, Glenn?
Yeah, I can hear you pretty good.
There you go.
You can hear me or you can hear Jim?
I can hear, I missed your name at first, but I can hear you pretty good.
Awesome. Can you
Right.
see everything okay?
Yeah, I can see that really well.
All right. You got any questions?
No, not right now.
You can participate in the discussions, Glenn.
Yeah, feel free to shout out any answers.
I was actually thinking, when we're talking about this, how I probably at some point in time, it'd be pretty nice to see, like, I'm a hands-on guy. So like a cadaver, or something where you can actually see the lung and everything and how the diaphragm, really moves that way.
Yeah, so I've done quite a few cadaver labs. There's a couple that I've done through the military, but it's really cool because we attach like hooks to the diaphragm and you try and breathe You can feel the suction through the trachea and into the lungs. Pretty sweet.
I'm hoping that I found a model of doing that using a Coke bottle. I'm gonna try and get it set up for Monday.
They can do some with balloons and
I sent a video.
Yeah, you put the balloon inside the bottle,
Yeah.
and you put another one on the bottom when you pull down and it inflates as well.
I'll be honest.
all right, you guys ready? You back to this?
Pretty good videos on YouTube as well.
Khan Academy, careful with that. It goes fucking deep. Does anybody have an issue with me cussing? I'm sorry.
No, I'm good.
I slipped in and out of military mode. I really apologize.
You'll forget about JJ.
This is the one that I sent him.
All right, so VQ mismatch. That is important because we talked about the Q. So the Q is what?
Perfusion.
Perfusion. So what is V? Tanner kind of already said it. Ventilation, right? It's pretty simple. It starts with V, ventilation, Q, perfusion. So we have a ventilation and perfusion mismatch. What does that mean?
Not getting adequate oxygen,
Okay, so let's break it down. What is ventilation?
breathing.
Breathing. It's a two-step process, right? We take in and we exhale. So inhalation, exhalation.
Yeah,
But there's also a lot of other things that come into breathing because we want to make sure you're getting enough oxygen every minute. Oh, what's up?
No, just,
What class?
yeah, one to four class.
I wasn't here.
Okay, I'm just gonna make sure she gets grabbed. with all real quick.
I was not here. No, I don't do that. I was not here.
Okay,
Okay,
you say you want, okay. Continue on.
got it. All right, so there's a couple of things that go into ventilation, right? Ventilation is the process of intaking and exhaling oxygen.
Keep going.
I thought that was like a bell or a alarm, but anyway. So into the mouth, down the trachea to the lungs, and then back out again is ventilation.
So,
Fucking tones. Oh, 7 o'clock. That makes sense. So ventilation, in and out, but it's also every minute. The amount you take in matters. If I'm taking 2 shallow breaths, is that good for me? Okay, you guys talked about like respiratory patterns and all?
not really, I don't think.
No,
No? Okay. I'm not gonna go into it.
just before it sounded.
This one's broken, it goes a little further back than the other
Yeah,
one.
I'm scared the shit out of you. Yeah, a lot of look on your face. Your face is still kind of white.
Pucker factor, at least.
Yeah.
It's the only one out of all like 12 of them that leans back quite as far.
So ventilation, we have a ventilation mismatch or that ventilation perfusion. So ventilation happens with breathing and take in, but also the amount you take in every minute, the amount you take in every breath. Perfusion happens at the alveoli. We know that that's the crossover of oxygen and CO2. I already gave you guys one. Give me another one where we can have a mismatch, where I can take in air okay, but I can't perfuse it to my blood. Give me something else. Gasping. Well, that's kind of a sign of those things. But what like major disease process could we see that we see common? Emphysema. So we'll talk about asthma here in a second, because that's a good one, and I like the fuck with on the brain on that one. So emphysema. What is emphysema?
It's,
Can't bring it up without knowing about it.
it's,
Yeah.
it's damage to the, what would it be, we just talked about with the smoking,
I don't like this.
the word, yeah, that one,
I know what scientific word.
where it kills the, kills the alveoli, so we can't take in as much oxygen as we need to.
Yeah, so that's the major thing, the major disease process from smoking. is emphysema. So we kind of talked about smoking. You got any others? Just wait, we'll get to yours here in a second. I forgot about. I love talking about asthma in respirations. COPD. What is COPD? We say those 4 letters all the time. What does that even mean?
Something that's not just.
What does it stand for? What is C? O?
What was the first one?
Chronic.
Chronic.
So think of what would block something,
Or be in your way,
obstructive flow.
obstructive.
Obstructive.
P,
Chronic. Pulmonary.
last word,
Disorder.
disease, right? It's pretty simple. Chronic obstructive pulmonary disease. That's a lot of big words, all together. What does that mean?
Means something blocking your airway.
Something, not your airway.
Or your,
The perfusion process.
It's blocking in here, right? That's what we know. Something is blocking here. It's used really common with CHF. I mean, you guys have heard that one.
I haven't, but not that you would.
No, I'm not asking if you have, just you've heard it.
I don't know.
Right?
I have a guess on
People
that one.
that have COPD, you see a lot of times, you see it in conjunction with CHF, when they have congestive heart failure. So congested, what happens when you get congested in your nose? You have shit up there. There's just a lot of crap. Yeah, so you get a lot of crap, and you get a lot of crap that your heart has to push against. Your heart is actually two organs. You guys know that? Two. When you guys were talking about this real, I know, Cher talked to me about going down rabbit holes.
Well, hold on. I wanna hear.
Yeah, so your heart has two sides, right?
Mhm.
Where does the right pump blood to?
go up,
Not quite. Where's it gotta go first?
the,
I mean, they're right there on the picture.
go up.
The lungs, that's it. So is the right side of the heart has a muscle around it. Is it really strong? That's a yes or no question. 50-50.
No,
No, twice in.
it doesn't have to pump it that far.
It doesn't have to go very far. There's not a lot of pressure that it has to push against. So the right side is actually very weak. Where's the left side pump blood?
Everywhere.
Okay, everything else. And it's strong. It has a thick muscle right there. So if you think of the heart, even though it is one organ, I'm not trying to go against science and say I'm right. Think of it as two different sides with two different functions. Understanding that a really weak right side pumping against congestive stuff is gonna struggle. I struggle when I get congested. Right, here's Manfred. Your heart has the same problem. As soon as it has to pump against a little bit of pressure, all about my life, you're having problems, right? So there you go, congestive heart failure, pushing against pressure on the lungs slows blood down from going there. Does that make sense? So we don't have an issue taking air in, we have an issue getting blood and transfusing or moving those things through the process of osmosis, getting oxygen and CO2 to change sides. Okay, so asthma. You talk about asthma. What's asthma?
Is that like constricting stuff inside the lungs and not necessarily?
Not necessarily the lungs. Yeah, so it's constriction around the muscles and the trachea, around the bronchioles as well. So you go around the major parts of the lungs, but it's not here. So asthma is really cool because it's actually more upper airway than up here, whereas like CHF, COPD, those are actually in the lungs, like deep in there. Another good one that we're seeing a lot lately, especially after COVID, is pneumonia. What the hell is pneumonia? What is that?
Again, lung infection with it.
Yeah, it's just an infection, but what does that infection do? What happens when you get an infection on your hand? What does it grow with? It starts with bacteria. What grows in there? There's all that crap.
Simple puffer.
Yeah. It's pus, it's fluid buildup. It's all of that shit that it needs to grow, and it just occupies space. Now we have those things sitting in fluid. They are occupied and they can't move blood over there. So that's how we get our VQ mismatch. Okay. So those are really, really simple, really easy to explain. You think about them on a broad topic, like, oh my God, I'm just gonna push oxygen to fix them and get more in there. It's not quite how we do this. What do we have to fix? I'm sorry, let's go.
Would anaphylaxis technically be a V2 mismatch as well, or is that?
So think about anaphylaxis. Is it gonna be more of the ventilation? It is gonna be a VQ mismatch, but what side? Where is it at? Because VQ mismatch only gives you one side. Where is the mismatch in anaphylaxis?
Perfusion mismatch, wouldn't it? Because it flows off your airway, so you'll be able to oxygenate.
So what side is that?
Perfusion.
Perfusion getting air in or out, or is it moving it around?
Would be moving the oxygenated water out, wouldn't it? It's a
Trick question.
It is. It is a trick question. Because what else does anaphylaxis do to your body?
Stop breathing.
I mean, it stops your, it doesn't stop your breathing, it can. It would-
So what,
Close it right down.
Yeah, it slows it right down.
so what is it? What is the process of anaphylaxis? Why do you get anaphylaxis? Right, allergic reaction. So you'll get this later on in allergies and stuff. But with an allergic reaction, you get a dilation of all the blood vessels, which leaks fluid into the tissue around it, which causes a VQ mismatch at your capillaries that are in the extremities, in the body, in the lungs, but you also get the constriction of the bronchioles in the airway, which causes a ventilation mismatch.
And this is where he was going with the trick question.
Yeah.
So is anaphylaxis a mismatch? No, because both sides of it suck. They're just both tanking. That's where it's causing problems. That's where you're starting to have issues with anaphylaxis, is because it causes multiple systems to fail, to really suck. This is one side or the other. Okay. So we talked a lot about, like, taking air in, but minute volume matters. If I'm not taking enough air in every minute, I'm not getting enough air around my body. I am not removing CO2. Well, we jump. That might be straight. Talk about minute volume, but then we also need to talk about tidal volume. So tidal volume is really important in patients that are taking air in, because if I push, is there a BDM up here?
Yes, somewhere.
Yeah. How big are BDMs? How much air is in them? Depends on which one you're using, right?
An adult is usually a liter, but
Liter plus. What brand you got?
it's the blue brand.
Medline.
Medline. So Medline is almost like 1,600 milliliters of air. This thing is huge. So these things are massive. How much air can fit in our lungs? There's actually a really cool formula, but we're not going to go into that. So 300 milliliters is actually pretty close. So it's a rough guess. If I squeeze this whole thing into their lungs, what's going to happen? Yeah, or I'll pop it. If I just squeeze the whole thing, bad things happen. So tidal volume is how much you take in every squeeze. So if I'm taking in enough every squeeze, and then during the minute, sorry, we need to run.
No,
Thanks for the
If-
question.
so if, I know if your lungs can only take in so much water, then you have
That's a great question. I feel like.
to. Okay,
So there is a formula that's in your book on how to figure out tidal volume,
Oh,
how much per,
yeah, we just went over it.
yeah, I don't remember it.
You
but
don't
I
remember it?
remember reading it.
right? So everybody's lungs
We'll talk
are
about it.
within a certain aspect of it. Like the taller you are, the bigger you are, theoretically, the bigger your lungs are.
You're safe to go 4 to 8 milliliters per
Yeah.
kilogram. But that's-
Now, just
Older.
because they're obese doesn't change the inside of their body. So if they're 4 foot tall and 300 pounds, Their lungs are still set at a 4 foot tall
Now you're
person.
getting into ideal body weight too far. And she gave me shit for not going too far down the rabbit.
Well, it's
All
just,
right, fine.
just to remember that it doesn't matter how big they are, it's how tall they are and stuff like that.
I used to have
About-
them memorized, but I'm not.
Yeah, about 350 to 400 is about what you want to put.
Yeah,
So that's
three.
why we talked about watching the chest rise. Once you see the chest rise, you're good.
Once we know we have expansion, we have what is called the equal amount of tidal volume that they can take in. But does the trachea absorb oxygen? Shaking your head. No. Does the mouth absorb oxygen? Where do we actually have oxygen absorption? Those things, right? Bubbles, in the bubbles. So what do we call the trachea, the mouth, all the crap that doesn't absorb oxygen? Dead space. Call it dead space. The dead space does nothing. That's why we call it dead, because it's useless. So if I am guessing on somebody's weight and doing this stuff, I have to take into account dead space. That is something that you guys will actually help out with a paramedic in the field. You will help them, because I forget all the time I'm doing shit. That it.
So, Jim,
So I forget all the time about dead space and forget to put it in my calculations when we're talking airway and stuff, especially when we're doing like cool programming things with ventilators in ER or at my other job. So dead space. The only reason I brought it up, road memorization, it just means the mouth and the trachea have no use outside of movement of air, right? That's a good one. All right. So now, talking about problems. That is a terrible knife. Whatever. Not gonna try. What is that? A hole. What happens? The pressure when we introduce a hole. Yeah, it doesn't. It's not there anymore. What's the fix? Plug the hole. But does that fix the insides? No. How do we fix the insides? How do we make sure that this can still happen, that we still put stuff in there if we just plug the hole? We do. We have to build pressure back. How do we do that?
I got this far.
That's, I want to remember that for future classes. What can we do?
I forgot what the process is called, but I don't think we can do it once you stick a needle in it.
Yeah, so NTD, right? It's above you guys.
We call ALS. That's what we do.
Yes.
You guys call more people. You get more.
We call it Jim.
Yeah, you call Jim, or you call Tanner so he can watch and go, oh yeah, you need to do that, but I can't do it. Right?
That's all right.
So plugging the hole fixes everything. It fixes it. But what do we need to do? We need to fix the pressure in that lung. Do we remove that knife to fix the pressure?
No.
No, absolutely not. I'm scared of that crap. It's gonna stab me, huh? Well, knives are dangerous. They stab people. I don't want it around me, right? It's like gun shoot people. Yeah, same thing. So here, I've got a knife sticking out of my chest. We stabilize, we make sure that we can provide that support, and then we give them respirations manually ourselves. What are we trying to do with those respirations?
Build pressure with it?
I'm trying to get pressure back. Is it gonna build all the pressure back?
No.
No, but we're providing assistance. So these things are really cool because I've been up here for, oh shit, I've been up here for like 7 years now, 6, 7, whatever. I've been here for like 7 years, and I think the amount of times I've used these on people that have actually needed them is few and far between. And I'm learning more and more about how to use this to assist people with that. And it's pretty cool to give this to somebody when they're breathing. I'm not going to stick this on his mouth because it looks kind of grody, but even if somebody's awake, we should be using these things and helping them. Is this patient gonna be awake? God, I hope not, 'cause that's
Probably
gonna
not.
suck. Like, that's gonna be painful. But if he is awake, you know, he's at, what's that, water hole? Up there on the north side of town? Yeah, he's at the water hole.
That's what happened.
And yeah, so, yeah, right, that would happen up there. So he's at the water hole, gets in a fight, this happens, and he's having issues breathing. What are some of the signs and symptoms that we know he's having problems breathing besides the knife in his side?
You took mine.
Gasping, shallow breaths, what else?
Lots of breath.
Poor perfusion. How do we tell poor perfusion?
Mm,
Color,
temperature,
color wear.
Skin
everywhere.
What'd you say?
What was that, Glenn?
Color on your skin.
Said color, skin color.
Yeah, skin color. Where's a
Figure
really
answer.
great place to see it first?
Lips.
The lips, right? We'll see it in the lips. What is the one thing that a lot of people miss, especially with the water hole?
Mental status.
Mental status. Hopefully he hasn't been drinking all day and that he's just, a little tipsy. We can still ask him some questions. Judging by that place and the amount of people I picked up there, they've probably been there all day. So is that really a good example?
You
No.
start at 10 a.m. at the water hole.
Yeah, he probably started about
You
10.
can't go all day, you want to start in the morning.
Exactly.
So altered mental status. Your brain is affected by slight changes in oxygen. So altered mental status is usually one of the first signs that they have a poor perfusion issue. Besides the knife, if I can't see the knife sticking out, or he has some sort of issue with his lungs and perfusion, I can ask him questions and all of a sudden he's not answering correctly, or she is not answering correctly. I know something's going on. It keys me into what is going on and where to start looking. All right, any kind of questions about that? Kind of get like solid straight on the knife. So with the knife, if I were to take the knife out. Yeah, take the knife out, we got a loss of blood. Is that a VQ mismatch?
Yes.
On what side? Perfusion, right? So that is a different type of shock. Now we've got blood loss. What do we call that?
Hydrostatic shock.
Keep going. What's blood? What's the scientific name for blood?
Hemostatic shock.
Bleed. What?
Hemorrhagic shock.
Hemorrhagic shock. So you get hemorrhagic shock. We now have the amount of fluid is a problem. Okay. We don't have an issue here. We have an issue with the amount of fluid. Is there anything we can do to support them and help them with that fluid? No. Nope. We don't carry blood on our ambulances. We don't do that stuff here. So what is going to be their saving grace?
Leaving it alone.
Riding really fast.
Blood
Yeah.
pressure.
We're going to lead into, how many of you guys know what March is?
What is March?
March.
A month? The way you stomp your feet?
It's something we'll get into later on, but this is a good place to introduce you to it.
Yeah. Head back.
That posture.
No, Ian, just that back.
14. How do you have a bad back
I
already?
wish.
So this is March. This is our treatment algorithm. This is what I teach people all day in the military is March. So massive hemo, what is that?
Blood loss.
Massive amounts of blood loss. We have someone cut off their arm and they are squirting blood everywhere because they got stuck in a tractor. That is massive amounts of hemorrhage. Why is that up here first and it's not down here with circulation? I know I didn't write this down, but what's that?
This is a major life threat.
It's a major life threat because of that right there. So there's been a lot of research done on, it used to be called HABCs. Before that, it was ABC, airway, breathing, circulation. You would see somebody bleeding and you wouldn't treat it until after you taken care of their air. We had thought getting their airway taken care of first was what actually saved their lives. This has developed to become March. So massive hemorrhage, we are trying to control their EQ mismatch. We are trying to help them support themselves by stopping the blood coming out. Airway. How do we treat airway? I've already given you guys one today. What's the most easiest one to do?
Position of comfort.
Position of comfort. If I am sitting here like this and I am managing my own airway, do you need to move me? Nope. You need to lay me down. No. If my oxygen saturation rate is at 86%, what do you need to do?
Put you on oxygen.
Nasal cannula or a mask, right? And just let me sit here. Probably try making me lean over a little bit, convince them. But am I going to lay them down on their stomach?
No.
On their face?
No.
No. So we've taken care of airway. That person's talking, they're awake, they're alert, they're great. Airway works. Now we're into respirations. Just like I said, I have an issue at 88% oxygen saturation rate. Is that a problem? Yes. What's our magic number?
96.
Yes.
So we have a magic number, and there is a reason for this number. I'm not going to get into the disassociation curve too much. I will talk about it. So that magic number at 94% is where we start seeing issues with people's mentation. That's where we start seeing issues with color and their ability to function correctly. So this VQ mismatch. I don't know if you'll be able to see this. There's a pretty cool graph out there. And I'm not trying to like get too deep into it. We're not going to talk about all of the things that normally go on this. But our magic number of 94. Hey, can you see that?
Minnie Boo.
He's about got it there. Yeah, I can somewhat see it.
Right here, you can see this? Yeah. Yeah? Okay, so this curve looks like this. Why is 94 our magic number? Really, really terrible. When you hit 94, there is a sharp drop. It's bad. I don't have a sharp drop. I am terrible with drawing graphs, and I'm really bad drawing markers. So you guys can see by my knife skills and how this graph turned out. My handwriting is also garbage too, so I apologize. Yeah, I can draw circles.
I can't, so you got that on me.
She drew a flower. That looks perfect. It looks like a bouquet.
Thank you.
But I thought she drew that. No, you did that.
I did the.
That's right. You did the lines and she drew the circles. So, or did I do it? No, whatever. So here we have the 94%. So 94%, I see 94%. I know that person is maintaining what correctly? Respirations. I know that I can move on and keep going down that list. So guys, this is your treatment algorithm right here. Okay. Massive hemorrhage, airway, and into respirations. So respirations matter because that VQ mismatch gives us where our actually treatment needs to lead. Whether we need to treat their airway and go back and help support them with managing and keeping everything open, what we call open, patent, right? We keep their airway patent, or do we need to provide oxygen support for them actually moving oxygen into their lungs? And if I'm pushing oxygen into their lungs through a nasal cannula or through a mask, and they're still having issues getting their O2 up, now I know that there is something wrong on the inside. It's helped me key in stuff. It's helped me key in and look at certain things. All right. Any questions about this? No? Take 5 minutes. 5 more minutes. Get up, get moving. All right, not that.
Jonah's like, I'm gonna take a walk. Yeah, oh my god. You said that in absence.
And I looked over, I was like, oh,
What did you? That makes more sense.
What is I wonder why they're not related. Like, they have a puddle of blood around them. Crazy.
Are we going back to our seats or are we sitting back at the front?
Wherever you want, I don't care.
You're kind of teaching. It's actually kind of what you
You're the one that
want.
needs to learn. What's better for you? Are you gonna learn better sitting on the table or are you gonna learn better sitting in the chair?
I didn't know.
I'm not trying to like snap at you or any of that. It's, what do you need? She is. She got her grumpy back.
Okay, Ian, you're done.
That was the first call this morning. When I was here. It was like 5:30.
It was a fall.
We brought.
That's a good fall.
No,
No. He did tap out. Head down the wall.
nice. Oh. No, like 5:30 something.
Yeah.
Oh, it's up from there. I actually thought it was you and I with us for a second when I was listening. Hello, James. Yeah. What was funny was primary go out, runner up gets called down here, primary get called
Yeah.
runner up. I don't know twice.
Was that drowning today?
Yeah. I was gonna ask was on primary today. That was, Eric and Shelley were on that one.
Shelley?
Yeah, she was in our class last year. She used to be in sterile supply and
Oh.
is now working for us.
When I read the thing, it said,
I mean, you need chocolate, peanut butter, chocolate.
So the.
I haven't eaten since forever.
They came by emergency.
Thank you.
Like, and Carrie was like, well, that's usually a bad thing, isn't it? I was like, you just don't fuck around with drowning. You just don't screw around with it.
He was stable and unstable.
Yeah, but most people that are conscious after, drowning are stable and unstable.
Yeah, I got there.
What you looking at?
Worked on it for a little bit there before the end of the stuff. I thought, cause I heard 6'5" drama out like immediately.
So how does one touch a book and stain all of it?
So the grapevine.
I don't know what you're talking about.
I'm curious about that.
To the hall.
Yeah, I need that
That's why I
tip.
got two high school. I don't ever look at my.
What's your, like,
I
when
got
you
two
would
I had almost every
take
day.
your test, how did you study? What?
Sounds like a call.
No cards.
Okay.
Rick went
I love no cards.
to high school.
I still have, like-
High school. And Alex went to high school. And Trevor brought,
Filled up two of the note card holders.
just 'cause we weren't
When I was going through paramedic school.
drowning and conscious.
Highlighted my book. I hated going back and rereading it. But what I would do is I would read and highlight, and then I would go back and read. I take the highlighted pieces and put it on a note card.
And generally they're doing some
Road
practice
memorization is
things.
great, but
Actually, no.
I learned the best things later on.
He didn't win the fight.
And
That's
critical
true
thinking and
survival
thinking
right there.
through stuff, like I'm kind of pushing you guys tonight.
Survival and fittest.
Well, it's like-
Lost.
I like
That was
this a
much,
lot better.
much more sick than what I got.
Jokes that went through my head afterwards and I was like,
That's what
You
my
need some
dad
chocolate,
said
you
too.
want
He was
your-
like, I held myself together on stage.
Tell you what, I had the best joke this week.
Peanut butter.
Luke Combs did a cover of a song with a black
Oh, yeah.
queer singer, and Toby Keith just couldn't stomach it.
That's what you did there.
I didn't know you had cancer until like.
I didn't know that's how he died.
Yeah, that's where I was at.
I thought,
Actually, he died.
I thought he made the announcement like a couple of years ago.
He did.
I don't
I don't
really
pay
like country
attention.
music.
Oh,
I knew because I saw a picture of him. He looked.
Didn't you live in Tennessee too?
Looks like.
Two should be 3 in July. I got
What day?
21st or 24th. Sorry, I got her tattoo because I can't remember birthdays and anything like that. So
He's July.
terrible. I can,
Touches a book and gains all his knowledge. Can't remember his
yeah. So my oldest daughter, she's 16. It took me a year to learn how to spell her first name. My ex-wife, it's
That's how my dad was with my brother's middle name, so it's fine.
took me fucking forever just to learn how to spell her name. I had to write it out.
To be fair, that is like the most difficult
To be
way to
fair.
spell. Right.
To be fair,
No.
that is not the most difficult way. I've
It's
seen
one
other.
of the most difficult.
It's terrible, and it took me forever to learn how to do
You
it.
can't, that is not something you can spell or
You go
sound out.
talk to a suburban white mother and then we'll find
That's
8
true.
more difficult
but-
ways to spell Riley besides that.
My friend's Kate, her name is Kaylee, that's spelled the same way.
All right, you guys ready to do this?
What's your brother's middle name? Emmett. So my mom, when he was born, wanted to spell it E-M-E-T-T. My dad, on all his military paperwork, spelled it E-N-E-T-T, and on his birth certificate, it's E-N-N-E-T-T.
So 18 different ways.
Yeah.
Yeah.
So
That checks out.
nobody actually knows how to spell his name, including him.
I ran into your mom brother this morning.
Oh, at the hospital?
Did I say I had a baby?
My grandma, no, has surgery today.
When I signed on the table, your phone went.
I was just,
Yeah.
I was leaving.
I was like, oh, it's
He was like,
That was,
he's like,
that was a fucking while ago.
He's like, "Wait, I know
Here's
that
a
guy."
picture of him.
yeah.
That was August last year. The brunette is not mine. That is my now ex-wife's daughter. Anyway. All right, you guys ready to do this? What's that? All right, so up on the board, we have 5 terms. They're kind of important. They're kind of need to know things. What's up?
You shouldn't help
Lack of blood.
Hypoxia?
Lack of
Hypoxia
oxygen.
is low oxygen,
Oh.
Thank you.
Hypercapnia is
high CO2.
CO2.
So,
Yeah.
right, why do I have 2 opposing terms up there?
Because too much or too little something.
Well, if I'm hypoxic, I'm probably hypercapnic. So hypoxia, there's actually 4 ways we can be hypoxic, but I'm not going to go into it. All we know is that hypoxia is low blood saturation oxygen. Okay, hypercapnia. Actually, everybody give me an example of hypoxia. When can you be hypoxic?
Shock.
Shock, that's a good one.
Air.
How high up in the air are we? What's our altitude?
Elevation.
Elevation is a great one. Once again, I have terrible handwriting. What's that?
Exercise.
Exercise. I can be hypoxic from anything. Swimming. You can actually make yourself hypoxic through the use of your muscles too much in swimming. I've seen it happen quite a bit. You get cramps every now and then. That's a hypoxic sign. You've actually got a lot of electrolyte deficient problems going on. But hypercapnic. What's that? No, what did you say?
I said, why are they playing with the train horn? Did that not sound like the one you have?
That was the highest train one I've ever seen.
I'm pretty sure that's one my dad bought. Anyways.
Anyway, hypercapnia, what is that? high CO2. Okay, so what do we learn about here with the board or the board on the ground about hypoxia? What's dangerous about that? Poor perfusion. So that's shock. We are trying to stop shock from happening. So someone in a hypoxic state is dangerous. Hypercapnia. Do we have anything that can tell us if someone has high blood CO2?
Yes.
What?
It's the red machine.
Yeah, the red machine. I
The
was
thing,
saying.
the boxy thing, right?
The red machine does not.
It does not.
It doesn't?
It tells you if you have high CO.
Oh.
Carbon monoxide,
Okay.
not carbon dioxide. That is a carbon monoxide detector.
So then I'm gonna.
Measures our
Wait.
tidal CO2.
With what?
I don't remember what it's called.
The thing?
That measures our tidal CO2.
Isn't that capnography? No.
Capnography. Yes. The little nose thing, the little dangly thing, right? The big old orange thing that hangs down there. We can tell if someone has high CO2 by capnography. How often have you guys ever seen capnography?
No,
It's
we've
ever,
heard about it a
it's
lot.
really, really easy. The wave looks like this. That's it. It's a big square box. Sorry, you guys can't really see that very well. Screen was not very good. So it's a box. When you have that waveform like that, where it just kind of goes out. But if you have someone outside of their ranges, you guys don't need to know their ranges. If you guys determine that someone is having some issues with hypoxia, put them on capnography. Okay, so hypercapnia is dangerous. Why?
It can cause hyperventilation because CO2 dries.
Oh, because it reduces your respiration rate.
Raises it.
Raises your respiration.
Your chemoreceptors sense the amount of CO2 and it raises your respiratory drive. You'll also have some weird changes in their mental status. It's really cool because altered mental status is a sign of everything. So you're never wrong to say altered mental status on any paramedic test or EMT test. So hypercapnia though, when we look at hypercapnia and they're breathing at a really fast rate. I know you guys haven't learned about breathing patterns yet, but there is a breathing pattern that's super deep and super fast. Why?
It's trying to get the most oxygen as possible and compensate for the non-CO2.
It's trying to compensate. So compensation here during that breathing pattern, your body is trying to breathe off bad shit. That's all it means. It just means it's trying to get rid of all the bad crap that is in your body. In that case, the bad shit is actually sugar. So it is trying to breathe off the acid that is sugar. And a lot of hypercapnic scenarios, you will see people just breathing very shallow and very fast. They're trying to breathe it off. So that's a sign that we can do what? I hope you guys know this. Like I've said this like 7 times. Like, put them on oxygen, right? So here, hypoxia, what can we do? Put them on oxygen. Hypercapnia, what can we do? Put them on oxygen. What's the solve? We put them on oxygen. Pretty simple, right?
Yep.
Cool. Now on to the bottom words. Distress, failure, arrest. What is that? Which one's worse? Arrest. Which one's the lightest, most easiest one to fix? Distress. If you are in respiratory distress, you are struggling with something. If you are respiratory arrest, oh shit, bad things happen. Okay. So respiratory distress, respiratory failure, respiratory arrest. These are the 3 levels of the respiratory failure mechanism. I don't know what to call that anymore, actually. What do you feel like the steps, the respiratory steps? I can't. Thought there was something for it. There's actually like a name for it, but I don't remember what it was. Yeah, so it's just the 3 phases you go through in your respiratory drive. So respiratory distress is really easy. We can see it. How do we know that somebody's in respiratory distress? Tripoding. What is tripoding?
They're leaned over trying to catch them.
They're leaned over trying to catch their breath. You ever heard of peep? You ever heard of someone peeping themselves? It's really cool. So you'll see them go like this. They'll lean forward and you'll see them take a breath. What am I doing with my lips?
Limiting air.
I'm sucking air in, but am I letting air back out very easily? No, so that's called peeping. So peeping keeps air in the lungs. We're trying to keep an open shit up. It's a pressure mechanism. So in respiratory distress, you'll see people doing that. It's really cool. There's actually a couple of people that I've seen here where we'll walk in their room. Actually, I think I was on one with Jim where we walked in and they were sitting on the couch and they wouldn't talk and they were just pursing their lips. Face was blue, struggling to breathe. What's up? Question?
No, sorry.
No.
You see a lot with COPDs.
Yeah.
Because they're trying to force that alveoli open. So you see them taking a deep breath and up.
Yeah, there's that pursing.
It's called pursed breathing.
So respiratory distress, we have the beginning signs that their respiratory system is failing. Respiratory failure. What's happening? It's just shit's going down. It's bad. They are shutting down. They are using accessory things to breathe. So the reason I have this up here is I like to talk about this with kids. Why is this dangerous with kids? Hey, can you still see the board?
Yeah, I'm good, Jim.
Tilt it down a little bit. Yeah. Sure. Okay. All right. So respiratory distress. How do we know? Oh, how do we know when children are in respiratory distress? Kids. What's the difference between adults and kids? What's that? More mouth breathers. What else?
I was just saying, kids can withstand it longer, and then when it's shit.
Yeah. So kids' accessory groups are able to stand up better. So kids will be here a long time. They will be here very quickly, and then they will arrest suddenly. How do we know that kids are struggling to breathe? Yeah, that's one.
Chest.
What do we call that?
I can't think of the
You
word.
can't think. So what do you call it when something comes in? Retractions. You're close, right there. You had it. Retractions. When you start to see their oh shit, I just lost the word.
Intercostal.
Thank you. When you start to see their intercostal muscles, see, I forget shit all the time. I don't know what Cher was talking about. When you see their intercostal muscles start to come in, when you start to see their sternocleidomastoid muscles really, really moving, and you see them like flexing in and out, you see nasal flaring. When those kids are doing that, they are struggling hard and they need oxygen now. They do not spend a lot of time in failure. When those muscles shut down, they are done. So help them very quickly. All right. So respiratory distress, respiratory failure, respiratory arrest. What's the difference? Distress, kind of struggling. Failure, circle in the fucking drain. Arrest,
No.
in the drain, going down the pipe. Bye-bye. Good luck. Find a chaplain. So with these three is just basically rote memorization, knowing which one is worse. How do we determine when someone is in one phase versus the other? Just like how I said, you can kind of see them struggling, you can see them really hurting, and then you can see them dying. That's it. All right.
Adults, like we had one earlier today that was guppy breathing, what we call it. You've seen a fish out of water. Does that. kind of struggling to breathe. We had class. Yes. When you see that, you're like, now I know what it looks like, now I know what I need to do.
Guppy breathing?
Yeah.
Agonal breaths. What is this?
Quite agonal, but
What's that?
pretty close. She was getting close to agonal.
Good luck, God bless, enjoy the afterlife. What do you call this? What is this?
BBM.
What does that say for?
Bag valve mask.
Bag valve mask. What is it used for?
Assisted breathing.
Assisted breathing. What do we use it for? We provide oxygen through assisted breathing. So we have these cool little nozzles right here. You can hook up other things onto these. This one looks like it already has a P valve on it, kind of. I haven't messed with the Medline ones very much. We have the Ambu bags.
It doesn't have a,
No, it's not a P. That's not a P valve.
it's got a relief.
Oh,
But it's not quite.
Never mind. So these things are really cool, but what do we call this? What is this whole system set up right here? Are they able to breathe on their own?
No.
So what do we call breathing scientifically?
Respiration.
Ventilation.
Ventilations. Remember, in and out, both is ventilations. Okay, so inhalation, exhalation, ventilations. So we are providing artificial ventilation and we're assisting with this. So artificial ventilations are great. How do we provide artificial ventilations? What are some other ways? Intubation. I mean, it's really deep. You guys can't do that.
Okay.
How can you guys do it? Because
Calling ALS.
you guys have done BLS, right?
Yes.
CPR, right? What is CPR? Cardiopulmonary resuscitation. It's pulmonary resuscitation as well. So how do we work in CPR status or in a CPR type mindset to help someone breathe? What can we do? Just chest compressions don't really help somebody breathe.
Breathing like this is just,
Breathe for them.
yeah.
What are the methods they teach in BLS to breathe for somebody? We've got direct, which is mouth to mouth. Absolutely disgusting. I will never do it. What else do we have? You have pocket masks. Those are really cool things. In my EMS pants, I always carry a pocket mask with me. It was like, I think I've been here for 6 months and I saw somebody in the park that's right over here. Gave him Narcan and he threw up and I was like, that's the most disgusting thing I've ever seen. Ever since then, I was like, I almost put my mouth on that guy's mouth. I wanted to be a hero and be like, I'm fucking in on this. Really glad Carlos was there because he's like, wait. So I wanted to jump in and give this guy mouth to mouth because I was a hero and thought I could save him. What would have happened if I'd have blown into his mouth besides the throw up? What's that? He would have got vomit in his lungs. Where would I have been pushing air? The stomach. So we have gastric distension. We see that stomach start to expand. We start to see him move out. What does that cause? He's going to throw up. That's a problem. Okay. So artificial ventilations are only as good as the person providing them. If I'm squeezing too hard, I get gastric distension and then bad things happen. And now I'm cleaning up throw up all over me and I'm probably throwing up myself because that's the one fluid I can handle. Terrible. Quick story. My baby threw up when we were driving. My oldest daughter threw up when she was 2, many years ago. We were driving to Minnesota. I had to stop the car and I threw up myself many times. I could not drive after that. It was terrible. Fucking vomit. Anyway. So what other ways can we provide artificial ventilations? Specific ventilations. What else? CPAP BiPAP. Can they do CPAP BiPAP? Nope. Nope, they cannot. They can assist. Though. So understanding how to set some of this stuff up is also very important for you guys because it also comes into play for innovations. So using when we're talking about the drowning victim, using that as an example, that guy needs positive pressure. He needs to get that water out of his lungs. So can we provide positive pressure with this?
No.
We can. But what happens when I let go?
Negative pressure.
It all comes back out. Am I keeping that fluid pushed out of his lungs? No. So what can we do? We put on something that will keep pressure in the lungs, that PEEP that I was talking about. So we put on a PEEP valve. It works, but these things, the PEEP only goes up so high. I think it's like 12. So it only goes up so high. We can put other things on, or we can innovate the patient where we can keep pressure on with this and that PEEP valve. Putting that tube down their throat is really cool, and I think I've done it twice. It's awesome to do. It's also scary as fuck, because you're doing the top rated airway intervention for somebody. It's a little nerve wracking. If you mess up, there's nothing after it. So helping somebody with this, we have to understand what we need to do to prepare. We have to understand what we need to do to get ahead of things. So you guys understand how to help people and be set up ahead of time will help fight these. Any questions on that? Got a little deep with the whole prepare thing. I didn't mean to go that far. My bad.
We go over it next Monday.
What's that?
I think we go over a little bit of it next Monday.
Yeah. All right. Here. You stand up in the back. Yeah, I'm terrible with names. So one of the cool things about the airway is the layout, the actual anatomy, and how we position somebody to give positive ventilation. And I like this because you can see his back. He's laying down. How does his airway look? So we can see, right? So we can see that his back muscles stick out here, but his head is forward. So this is anatomically wise correct for him. This is pretty close to what we call the sniffing position. So when you position somebody on the ground, we need to be able to do this. How can we do this on the ground? You guys get what I'm seeing here with this?
Yes.
That's one way. So here,
Or
do this. Stand against the wall. You put a towel under it. So just stand against the wall. So look at his head. He's got to like get back. He's got to get his head up just to open up his airway. And he's even trying to stand up. So I want you to just relax. Look at how far back his head is. Like that fall back screws people up. Okay, let's go to the front. Everybody up the front. I'll turn the camera. But you guys not want to get up? Like we can do this whole class like in the chairs. It's not as fun, and I don't like that. Where's that? Is that looking right around? I have no idea what I'm doing. Right. Right here? Yep. Yeah, I just put the phone. All right, so we just discussed how to properly move somebody because we know that laying down the ground, their airway is all collapsed down. It looks like crack. So based on what I showed you over there, what do you have to do to her head? You guys all see it?
Tilt it back.
So head tilt, chin lift, jaw thrust, right? I don't expect you to do the jaw thrust.
I was like, I don't know.
It will actually hurt. Just show me if you know how to do it. No, you gotta like really push in there.
Well, I know, but I don't wanna.
You're okay. Okay, so jaw thrust we know is right here. You just push the jaw forward. Head tilt, chin lift. Cool, great. What do we really need to do? There you go. I was wondering if she was gonna take off her jacket or not.
Thanks, yeah.
You're
Oh, sorry.
not supposed to help her.
Oh, sorry. Right, I'm dead.
You're dying.
Yeah, you're supposed to be down.
Yeah,
You're
sorry.
not dead.
Some of it.
Maybe I
I've
am.
never seen someone in distress kick
Yeah.
their little leg.
Yeah, she's so nervous being in
Right.
front of everybody. So this is called the sniffing position. And actually, we even need to get her head up higher.
Yeah.
Up higher. What are we looking for? What are we trying to do?
It's open.
It's what? Nice. Ears need to be up in line with the top of their shoulders, their collarbone. So head needs to come up. They're right here. Get in.
You won't hurt me by doing this for you, I promise.
So what does that do? How does it open up? It opens up the airway. But how? Right. It moves it forward and actually forces the trachea open. What do we do for kids? Why?
Their noggins are huge.
Noggins are huge and fat and problematic. I would use your baby as an example, but it was like he's passed out. She, he. I'm assuming he because he's blue and flannel. Yeah.
Cause he's blue and flannel.
So just assuming. So he, right? They've got their heads are not the same size as the rest of their body. Their airways, their trachea specific, is a lot smaller than ours and very thin. Him specifically, the little cricoid membrane right here is not fully formed yet. The little U-shaped things that we have in our throats, they're not all the way formed quite yet. They'll be formed here in a couple months.
He's
6, yeah.
Yeah.
So they'll be formed here in about 4 or 5 months. And they'll grow with him. What about his tongue? Huge. It's massive. It takes up a ton of space in his mouth. So how do we displace that? We could. You can use an opiate. They're garbage, but sure. So positioning for a baby is important. That's what matters. Positioning is going to give you the best results that you can get. Let them get to a position of comfort. How do you determine a baby's position of comfort? They do. Yeah. Somebody's in the back of an ambulance. How many guys have been in an ambulance? A lot of space, right? There's a lot of availability to move around. Easy walking areas. They can kind of sit down and get comfortable, and it's a really simple ride. How do we get someone comfortable in the back of an ambulance? Actually, let's just do this. Make some shit up here. Yeah. Fine. Not quite what I wanted, but go ahead and lay down.
Like this?
Yeah.
Okay.
Okay. So she's kind of laying on the cot, still kind of struggling. So what we can do is actually take it. Wow, that was gross. Maybe you should get off that.
Yep, I think so too.
That was disgusting. What we can do is we can actually lift the head of the cot and get her up to where she's kind of sitting right now. That was actually a much better demonstration than doing that.
Anytime.
I mean, those things are older than I am.
Wow. All right. That was cool. I think it got my mouth. So positioning, that 30-degree position, what do we call that? Fowlers. What's semi-Fowlers?
Between flat and sitting up.
Fowlers is all the way up. Semi-Fowlers is halfway. Think of it 45 to 30 degrees. Okay. So semi-Fowlers. Fowlers is sitting straight up. Actually, that correct posture. Not terrible about that. But anyway, what's that? It's not comfortable. I don't know why we even have it on tests anymore. No, I've never seen anybody use it. But semi-Fowlers is where we position almost every patient. That's also going to allow us to position their airway. So if you do the same thing, please lay back. So I'm going to move her up to semi-Fowlers. There you go. I can see that she's struggling with her airway, and I need to provide positive pressure ventilations. I can lean her back, and I'm right here. On the side, I can do the exact same thing. Get her here, and I can go over her mouth with the back. I can keep her position to where she needs to be. Am I going to lay her all the way down? Maybe. If I feel the need, like what's going to happen with her treatment, and she needs to be all the way down, we can lay her all the way down. Is that really going to help her though? Maybe, maybe not. It's up to us to determine that. So determining what the patient needs. This is usually the position of comfort right here. Sorry, I have to put your hands on the ground.
It's okay.
This is going to help a lot of people. Any questions about positive pressure ventilations, positioning, that kind of stuff? No?
It used to be that when we intubated someone, they were flat all the time. And science is starting to show us
15 degrees.
about 15 to 30 degrees is the magic spot for intubation.
Okay, you guys have any questions about any of this? No? We covered a lot of stuff tonight. A lot of actual like science stuff. A lot of the cool chemical shit that I like.
It was at death by PowerPoint, so
Yeah.
I'm not feeling good.
I absolutely hate PowerPoints. I've been trying to look through these damn things, and even that's like, ugh. when I teach in Cheyenne, I don't use PowerPoints. I'm discussion based.
That's why if you guys read your books, read the chapters before you come to class. It's a lot more interesting.
I try. I'm very low weekday.
Then when I read them on the weekends,
I
I do
was,
not remember them.
I was reading
I wouldn't say.
them, but then I was coming to class and we were going over.
The
I'm not talking about
exact
cylinders
stuff.
because we don't carry those things with us. Well, okay, I guess we can talk about cylinders. It's a part of the slides. Oxygen therapy. It comes in these cool cylinders. Everybody has seen an oxygen tank, right? In the side of the ambulance. They're big, they're green, they take in a lot of air. That's really cool. I think there's a picture of a smaller one. There we go. There's a picture of the smaller ones. Oh, even better. There's a real small one. There are two main sizes we're gonna have for those. There's one. Is there another one in there? Same size? Nope. Okay. So there's two main sizes. Sure. You need to know how much air in there? No. You need to know what size that is versus another size? No. No one's gonna ask you those questions. Okay. Yeah. What?
No,
No, what you said?
I was talking about looking at his newborn photos. My youngest is 6, so I told her she was giving me a
6?
baby.
How old are you?
27.
Okay. I wouldn't guess that, but. What are some issues? What are some issues we might have from giving somebody too much oxygen?
Yeah, I got really bad eyesight.
Really?
Yeah, you're good.
Bad back, bad eyesight?
Altered mental status.
Altered mental status, actually.
You said it was almost perfect.
Yeah, almost. What else? I feel like he's just looking at my feet. Can you like talk about? There we go. You get, shot down. What's up, Candace? Go ahead. Because you're looking it up on your phone?
No, I'm doing schoolwork right now.
Oh, whatever.
And, so with hyperoxygenation, especially with like your COPD emphysema, if you push too much oxygen, you can actually kill the respiratory drive over prolonged.
Right. So how does that happen? We've talked a lot about respiratory drive tonight and how high CO2 is actually what makes us breathe. Why is it with, what did you say, COPDers and what else? Emphysemas? Emphysemers?
Yeah, because emphysema.
You gotta come up with better words. Smokers.
Cause their brain's not telling them to breathe because, yeah, cause they're over oxygenated.
Well, their respiratory drive has been reversed. So they have gone from primarily relying on CO2 to primarily relying on oxygen. They have had some major physiologic changes where their body cannot survive on a CO2 drive. And it slowly changes and changes and changes. So if we give them too much oxygen, we can actually drive that respiratory drive down so much. Pretty rare, but we can do it. It is a problem.
Your body has a normal CO2 limit for it. 35, 45. As long as within that, you got that respiratory drive as a normal drive. What happens with COPDers and emphysemers is they get used to a O2, CO2 level that's in the
60s.
60s, 50s, 60s, 70s. And if you drop it below that, it goes, oh, hey, we're on normal drive, so it just stops breathing.
So we are taking them from a hypercapnic state and putting them into a normal state. Their bodies are fucked up. They are not normal. We cannot do that. So there's some dangers with giving oxygen every single time. Understanding when somebody has COPD or how their body works is really important for us. That's why I say, like, I love physiology. It's really cool, but really messes people up. How many of you guys know that your eyes are very oxygen dependent? So that 94 magic number, if you go down, there's a couple times in my career where we've had to make ourselves hypoxic. It's really cool because I hit about 90 and my vision turns gray. 90%.
Okay, but how did you just like hold your breath? Or?
No, we have to go in the special chamber and it drops the pressure of the oxygen. It's called an altitude chamber. Really
Too much
cool.
oxygen can also affect your eyesight.
Yeah. So too much, too little. We have that range, right? Everything in medicine is a range. So 94% is our magic number. But if you're trying to push too much, you can cause damage to their eyes. Because oxygen does what to our blood vessels? Does it?
Mm-mm.
No? Does it close them down? What's that?
Was it dilate?
You tell me. We're going through this. So if we think about how oxygen works on the body, what does it do? What does CO2 do to blood vessels? Sounds like great homework assignment. I know because I actually have the answer right here. So it can actually cause changes in the capillaries in your eyes. It can change your vision permanently having too much or too little oxygen. So damage to your eyes is really common with people that are struggling with oxygen. Like cataracts are really common. What about heart attacks? Yeah, we put everybody. You remember FONA? Remember those? So there used to be an acronym that we learned for cardiac treatments. FONA. O stands for oxygen. We would put everybody on oxygen. We're actually finding out that it's kind of dangerous to do that. It's actually really restrictive. So,
You're like, what? Yeah, this is not where
so any questions on that? I've gone through all of the slides, at least the ones that are pertinent and the ones that matter.
I will tell you the whole oxygen and cardiac arrest sounds good thing. Because so once again, the guys that wrote your book, that wrote your book and the Muslim book, they came to Cheyenne a few years back and
Is this the Brady book?
yeah, did a whole thing on pathophysiology. What happens is during a cardiac arrest, the cells become oxygen depleted. What happens is the old theory was get them up to 100%, just overload them with oxygen. And what happens is when those cells get opened back up, you get that spontaneous return of circulation. Those cells all of a sudden get hit with all this oxygen, and it actually causes the cells to explode. They just overload, and it causes more damage. So when we're dealing with people who are having an MI or not in cardiac arrest but having a heart attack, our magic number is to get them above 94% and not 100% like it used to be. So, and that's part of the reason we figure that 94% is a good oxygen rate, and survivability rates once we started doing that started going up.
Yeah.
It showed
94 is the magic number.
Yeah.
And there's actually other studies being done at Duke that are showing 90 works pretty well too.
Yeah.
Just 90%. All right. You guys want to go back to your chairs, go wherever?
Looks less pissed.
Yeah, he looks a little less pissed. Still like frowning at me. So angry. Go back to your chairs. You make them go through this on their own? Or can we talk about it?
You can talk.
Cool, let's do this.
This is
Group effort.
so once again, these are the handouts that we've given you on your drive. Remember what we were talking about on Monday was using these study aids. Be a good time to start, maybe take some notes as he's going through this. Hope you remember some of it. Okay, there you go.
Okay, anybody have any questions?
How's your day going?
Mine? It's all right. I had to get to work like super early this morning and
What time?
I got there at like 4:30.
Did you do military work today and then come up here?
Yeah. Yeah, we had a bunch of post-drill meetings and I didn't want to do all the meetings and not getting work, actual work done, because I've actually been on leave while I'm going through all this crap. So it's kind of nice because it's free leave and I actually had a beard until a couple days ago, but I had to feel like a real human to get rid of it. Sucked so bad. So I've been hanging out, just sitting at home playing video games for the last like 3 weeks.
Video games.
Lately I've been on computer games. Been on like a, what's that?
It's a PC master race.
I have so many jokes right now, but I know I can't say it in the crowd.
With the crowd.
With the crowd. The blonde hair, blue eyes, man, it's all matters. I've been on like Total War games where you play as like the French or the British and you try to conquer the world, All right, so I want to go through this quiz with you guys. I hope you guys are okay with that. Because I like going through stuff and talking about questions. This is me. What do you guys like? Do you just want to go through, answer, and then we'll talk about it? Or go through them together? What do you guys want?
The show was saying you guys were having a hard time with the way the wording was on the test today.
Yeah.
There's some things
that were worded stupid and there's some things that just didn't sound
The handouts usually aren't bad.
Yeah, the handouts are normally understandable. The tests are not the same as the handouts.
Yeah.
But we can do it together. There was a question on the handout from chapter 15 that the answer did not make any sense.
Sounds real. Yeah.
I mean, like I was telling you guys earlier, this book is written by a team of dudes that come up with this book, and it's really, really cool. And they hand it off to their interns at the colleges they work at, and say, make up some questions for a workbook on this. And then it's handed off to another set of interns and say, make up questions for a test on this. So, basically. And neither group talks to each other, so. Yeah, I wouldn't talk to them.
Yeah, dirty. They suck. I'll tell you.
Yeah.
Why don't you guys go through it? Go through, look it up. We'll talk about it, what, 15 minutes? It's not really long.
Okay.
Sure. Is 15 minutes is that too fast, too short? I mean, there's only, what, 2 or 3 case studies? I didn't look at this at all today because I didn't want to teach you guys from this. I want to teach you guys the shit that matters. I probably see there's one question that I did miss. You should have read it.
Obviously, this is gonna be a generational fulfillment, that would be correct, isn't it?
What's up?
Number 5.
Inadequate artificial ventilation, so you're not doing your job right. So, so A, look, that's taking method, right? So if their heart rate is normal, is it compensating for radiation? So A is good.
Yep, we already crossed that one out. That's why I jumped straight to B.
Yep,
Yeah,
yep.
we did the
So-
test taking method.
Patient's chest rising and falling,
Would be proper.
It's
then.
supposed
Yeah,
to
it'd
be.
be proper, so.
a ventilation of 12 per minute. How often do we breathe through? But that's normal ventilation, about artificial. How often are we supposed to squeeze that back? 10 to 12. Every 5 to 6 seconds. So which one would actually be the answer? Why B?
If you're giving them proper oxygen, you shouldn't be doing it.
Their skin color should improve, should get better. That's the only one that actually still has a negative connotation to it. Should have one in there, I don't know why Sheriff said I was so smart. I don't know.
She said it's untouchable and
I don't know why Sheriff said I was so smart. Like, I don't know some of this stuff.
When you touch a book and know what it says, you can't answer a fucking question.
Yeah, I think you should, right? I apparently take tests really well, but. What device on a bag valve mask may prevent adequate ventilation?
Maybe prevent.
Prevent. May prevent adequate ventilation. Non-jam, 1522 respiratory filter, non-rebreathing or a pop-off valve.
Questions? So the pop-up valve, you have pop-up valve that's popped up.
Yeah.
Or your air is leaking out.
Yeah.
So you're not gonna do that.
So squeeze back harder though.
Yeah.
I figured that'd be the one I get a reaction out of you, so
Yeah, no,
just try it.
to be honest with you, I've never heard of it.
I'm working on it.
So,
Yeah, there's some on here that I don't really care for.
So one of the big things on us. The thing that would,
50%.
Somewhere in the 10 to 15 range.
Yeah.
so this isn't, I'll tell you what. Yeah, you get 21%.
21%, yeah.
Would you like to come up here and join us? So you know-
We want to top it up to 20. That'd be cool. That'd make it work.
What is the 50%
I use my,
liters per minute?
so I got, when we were leaving the old RTI,
Mhm.
we had a bunch of shit in there and
Yeah, you're welcome to join us. if
Shane
you'd like.
was like.
No, you're not.
"Oh,
You were
you
mean
want
to me
any of this
earlier.
shit?"
No, you're not.
So I took one of the North American,
Where did you see that?
back up mask, a little canister.
Yeah, the
I
little
can't
canner.
find it.
Well, I had to use it last summer on a guy, because it was first time seeing him. And I mean, it happened right across the street from
15
our road,
liters
so
per
I just
minute.
walked over
Just
and,
walked over there.
yeah, pulled it out and I'm bagging the guy. And I come back down and, who's the
Guys, I
guy
did not
at the
realize
RTI?
Stepper was a smart.
When
Oh,
you
yeah.
get back
That's
there-
it.
For the wrong reason.
Russ Graham? Yeah.
Yeah, so he was in there and I was like telling him about it and get, like about 10 minutes later, he comes in and goes, here, we got a whole bunch of them.
Yeah,
Okay.
he's ordered supplies every year and then they don't do anything with it.
That's nice. Well,
It would be nice to
Use it?
I
to
guess
see
it's for supplemental oxygen.
that portion of the RTI go.
Like,
you know,
The medic section?
I mean, not read, but like actually do something.
Yeah.
So,
You guys have an E7 medic there that's not doing a damn thing.
cause right now, well, so like we're scheduled right now to do 2 trips a year.
For 200-300?
Yeah.
Yeah.
During or during, AT.
Yeah.
Well, I'm gonna be at freaking,
I know, they asked me today, they're like, hey, will you jump up and teach this class? You know, I'm already teaching T-Triple-C for the Air Guard, like 55 fucking people.
but
Just
just
sucks,
like,
man.
I was hoping that.
But they're
able to
not.
Sit in on that. It's like, we might even be back in the state by then. Just doing the CO2.
The calf mill.
So, this is what cat metal looks like. Just gonna look at it. It'll be the purple one.
You get turned on at least.
It takes about a minute.
It's gotta clear itself, so technically when you're doing it, you're supposed to zero it out. But it won't zero out until it's hooked out, and it won't zero out until it's hooked out.
Not surprised.
If you read the instructions on how to zero it,
I think all my
it
shit
says
was
open the
showing.
door, fix CO2.
After you called
Once
this
it's
into the.
zero, hook it up. Well, it won't
I'm not.
read it until it's hooked out.
Yeah, there you go. There's a There's the end tidal wave right there.
That purple wave is.
That's for,
Capnography. I guess it's not end tidal, it's it's still end tidal, but it's not like,
Here's your
it's
number.
not 100% end tidal because you're.
That number should be between 35 and 45%. PCO2.
No, that's blood gas, it's blood testing, PCO2. End tidal CO2 is what he's doing, but that's not a full end tidal, because true end tidal will be a full breath. He's got his mouth open, so he's missing
No, I
CO2.
don't. I'm breathing straight through my nose.
No, well, it looks like your mouth's open.
So a lot of times.
Yeah,
we're
he
not-
said, I'm breathing through my nose.
you said 35 to 45?
Yeah.
35 to 45%.
But that's what this is for.
Was that a question?
Supposed to catch it both sides, but
No, she's ready.
you get old people like, and you're getting a reading of 12.
Yeah. So a lot of times we'll take,
Yeah, I tell you, you open your mouth, it drops, it's not 100% reading.
yeah, so what we'll do is we'll take that, put the,
Yeah, you put it over their mouth. Or if you tape it just below like a nasal cannula, like a traditional nasal cannula, it actually lines up right in the mouth perfectly. Or you just put it in the mouth and tape over it.
well, and ours are,
Okay.
yeah. You can usually get their mouth breathers with the nasal cannula, and they don't get quite as much air, so you put that in the mouth. Another thing the CCOPDers do is
Put everything over the mouth.
mouth.
You can't breathe in your nose.
I hate that stuff. I'll give him like a blow by mask before I do that. That just is funny to me.
So they just do it themselves.
I know, but it's super.
What I do like about our nasal, or anti-CFDs, is it's a high pressure nasal cannula.
Yeah.
You can go till you're done.
Go. This will crank them up to 15, I've done it before.
You can. I don't like doing that. I'll
Scares
go
you a little
up to
bit, huh?
10 on it. But I've seen in the ER, they'll have that 15.
Yeah, I'm trying to crank that bitch all the way up. Turn it on.
My OT is actually really good. I'm actually sitting at 97. I don't.
Right here.
My unsettled is usually about 94, 93 to 94.
Untitled?
I mean,
Very good.
SPO2,
I just made it.
which even then is a terrible read.
I had to get AC1 or A1C.
Yeah.
Because my blood sugar was 122 at the DHA.
Yeah. You're showing that
And I didn't think,
pre-diabetes.
well, what I didn't think about it was that I stopped chewing. And I've been using
Using the Zen pouches.
no, they're,
Friends?
and no, it wasn't grinds. At the time, it's a vitamin infused tea. It's kind of like grinds that they use in coffee. It's tea,
Tea.
but it's vitamin infused.
Anybody else need water?
Well, I didn't spit mine out till I did.
Oh, thank you.
Night before. And so when I came in, my blood sugar was probably still high from there.
Probably was.
And so,
It shouldn't have been that high, but it was,
yeah,
it probably helped bump it up a little bit.
so I had to get one when I got back, and my blood sugar was like 107. So it's like,
You probably come up here and do a
Did you
stick
say
and it's
yes?
perfectly normal, so.
yeah. Well, my doctor still says it's pre-diabetic because of, what was the other one, hemoglobin? What's the other, you get your blood glucose and then there's another one. Can't remember what it was.
From the lipid panel test we do?
No, from the A1C.
Oh, I don't remember.
But
If you
its
find-
normal
or if
range
you
is 3 to 5,
go
or 3 to 6, or 4 to 6. And mine's at 5.8.
Oh, yeah,
So
Oxygen,
I'm
267,
pre-diabetic.
it has that whole thing, and if you just go through them, it, you can see it.
It's a transition. It's all
Would you guys get this eight?
Gastric restriction. See, the,
Being treated as a diabetic condition.
especially like this.
I
You
know
tell
we
me.
talked about it.
That's like been all over my thing. Like,
So a
that's, like,
potential complication of ventilating a patient,
It's like
not
once a month.
while you're
of
it was reached. There's only 2 of those that really apply to a patient.
Yeah, like every single day.
Gastric tension and patient wakes up. If the patient wakes up, is that a good thing?
These are usually.
So, just to have a proper, please, I hope you know, I'm not trying to mock you, but really, I would do these tests all day, like, this is EMT basic stuff, like, it's.
What was
I like test taking.
No.
We were told. Yes,
What?
that was also mentioned.
Yeah.
You like being smart.
I got a reputation, I haven't even been up here before.
To be fair, you
Feeling
and I,
judged.
you and I went to the bridge and I got pretty much a college level class on how the heart works at the bridge.
That was when you were still going through class, wasn't it?
That was when I was going through my A class, yeah.
Or was that a couple months ago when we were,
No, that was like the first shift I ever worked with you.
Yo.
It was my A class.
for all these fucking rumors you're spreading about me? Debatable.
What are for C and it's at the top of the pressure? No, now we're going to Casper.
We go to Casper? What you got?
Can't know. She's on flight.
Oh,
Last time Casper was in Colorado, so she'll be fine.
hey, you want some chocolate? You like chocolate?
Do I look salty?
No?
I made
Give
banana
you
bread.
snacks, it's happy.
Oh, good job. And I brought you veggies. Oh, thanks. She doesn't, she's allergic to celery. There's no celery. What?
Potatoes that aren't cooked.
Why
Why?
would I cook them?
They taste better?
Cause you.
Have you had french fries before?
But they're not to eat right now.
I didn't want to, you told me not to get too deep on the phone,
that
like
the
you were
good
very
stuff?
adamant to not go down rabbit holes. This is a rabbit hole, this is, no, I drew the 94% and said, this is it. We could definitely talk about oxyhemoglobin dissociation, but that is way over percentage also.
I think that's probably just good for them to know because we do look that up.
Really?
I don't know if that is too in depth or whatever.
I mean, you've got like 2,3 DPG on here, you talk about like blood enzymes.
I
and
think
stuff.
it's more just that they know what in title is and why we would use it.
Yeah, we've already
and all that
talked about
stuff.
in title
So
and
as
stuff,
long as they know that, then
Well,
good on you.
Yeah, that's kind of,
so we didn't talk about waveform though, we talked about the waveform actually phases of the waveform. Yeah, your Carrara cleft and shit like that.
He finally texted me back. He
Hmm?
said, they'd like to really.
No, probably not.
have a seminar and call with you about this.
Yeah, I
because they're still
moved past
concerned
that.
that-
I'm not even gonna, no, I'm not even gonna try it.
No, I was gonna say.
I just went to the
All
Phillips.
right, we'll get it set up.
I was gonna go with you, but then I got called in.
Oh, what the hell? I was gonna go, is it Cooper's Bar?
But
There's Cooper, there's the LB, there's the college.
I was gonna say the Fallon's going into the beer or something.
Fallon is not working tonight, so
Right.
maybe she would.
Yeah. That's fine.
Okay, well, thanks.
I was looking at salaries for.
What's that?
We're on the in the field
Start
portion
building
of
up
it.
something to get to machines.
In the field.
Yeah, it's-
Even
our
for you guys out
$7 an hour is only
Also, my mom texted my other mom and asked
Some
if
sort
it
of
was wrong.
is that?
Jay didn't tell her yes, so she didn't
something they're going
show it.
to
Oh, well, it's a good thing, because we're not even
first
here.
that's sitting in the cabinet.
Wait, thanks for.
One benefit I think of having here also.
Oh, I thought I dropped it. No, okay. Your partner discovered it. Oh, wait. What did you say? Respiratory
All right.
failures.
Nice work.
then you
Yeah.
can still
Yes, he is.
have the potential of running 2-3 ambulances out. Because of the on-call.
There won't be a cost.
Exactly. I don't know much, but I know like the volunteers that you have showing people, but then your volunteers to supplement.
You're
that's
right,
right.
Ian.
Zero is the rest.
Comes out with the idea.
As my notes say from this class,
I don't even know how to answer too, because I'm like, what could it mean? Nope, that's not, nope, nope.
I'm also
Yeah.
confused.
the rest is down the drain, find a chapel, enjoy the afterlife. That's what I put down.
Spot on.
Well, I think if he stops breathing, he's probably down the drain.
Find a chaplain, not a chapel, chaplain.
Chaplain.
So what are we putting here?
Chaplain,
Administer
yeah, the
oxygen?
reason that last right,
What
chapel
if
is
for-
right out, you know.
Wouldn't for one of these administer oxygen begin CPR?
Yeah. Because he goes what? Unconscious. Or unresponsive. As soon as he goes unresponsive, bam. Beat that chest.
I don't know. What, two, when it says respiratory failure,
I don't even know how to answer that.
would it be like, is he within distress failure arrest? Like, does he fall in those categories? Is that-
That's what I keep going back to. I keep thinking that it says, you know, what level is this patient at? You know, what level is he there and
Yeah.
why? Well, if you look at it, you know, where is he at?
At the beginning, he'd be in distress because he's just having difficulty breathing, right?
Is he just having difficulty?
No, he's barely able to talk.
He can't talk,
Failure.
Okay.
exhaustion.
So he's in failure and
And then
he
what's-
goes into arrest.
Yeah, he goes almost immediately into arrest as you get there. That dude was late stage failure.
The signs and symptoms of failure are can't complete their sentences or 1 to 2 word sentences. Using accessory muscles, unable, altered mental status. Gasping breaths.
The question is, would you say that this patient in respirators failures, this? It's not right.
Face
right?
question mark?
That's exactly how it's worded.
Yes.
Mhm.
that actually.
I believe you. You
I
know,
would love to see it.
the amount of grammatical errors I found in these things, and misspellings.
What?
Grammatically or dramatically?
Yeah, what did you just say?
I'll get mask.
No, you said something else.
I'll skip that.
Thank you. I thought I heard that.
Socket mask? What'd you say?
A
Posket.
Socket?
Mask.
I'm glad that almost everybody heard that. That makes sense.
I didn't, but I heard the repetition.
Posket mask.
Posket mask.
That's a thing now.
It's gonna be the only one.
You're welcome. No one will forget now.
For the last one, I thought you like gastric distension. That's exactly what I was about to say.
Yeah, we have someone puke
Did I say it right?
pizza in your mouth. and
Did I say
everything.
distension?
I never, ever do mouth. count.
Okay.
When I was doing my
No, I know.
CPR,
I just know what it is, but I
Sheriff
thought it
said-
was distension.
I think her exact words were, fuck their luck. They're having a bad day.
So if
I would say the same
That
thing.
was her exact
I was
word.
gonna die and I have a pocket mask on you, you wouldn't do CPR.
I would do CPR, but
Oh, I mean, yeah, you
Here's-
do compression only.
when you think about it, when you do compression only CPR, every time you push down on the chest and let up, what do you create?
Negative pressure.
Negative pressure. So what's that doing to the lungs? Drawing air into the lungs, correct?
But even like AHA and Red Cross say you're only getting 30% pull on it, like you're not getting a full breath.
Right.
So at a full, third breath at 21%,
Is there anything else other than?
you're not getting much.
But,
You're getting more than what you would do if you're not doing anything, but
you know, if you're getting 120 a minute, 30%, it's all, it's.
So,
So, and then they're going hypothermic, so now you're not releasing oxygen to the body.
So
and
we
you're doing
did.
it worse.
CPR on a guy who like pretty much died immediately when he was in the ER.
That was insane.
So after 20 minutes of doing CPR on this dude,
I
his
found my other
internal
answers for it.
CO2.
Hyperventilation
That doesn't surprise me.
The doc
and
was like, are we sure he doesn't have a pulse?
Yeah, we're gonna check some arms here.
Yeah, no pulse.
That's because
Great quality
That was-
CPR.
Yeah, perfect.
that was the most insane situation I've had for the years. Because literally, I was going up to tell Carlos, to be like, hey, we might have a pending
did you get
transfer. I
respiratory
opened
failure
the
for the
door
first one?
and I heard,
It is the
I think I'm having a
after
heart
doing number
attack.
two.
And I was like,
That's what I
chest
was
pain in the
thinking.
ER. And Carlos,
That's what I was thinking.
like, I ran back, I was like, hey, we need a room, guys. Like, this guy's, we need it right now. By the time I got to the nurse's station, they were calling it. We walked him back. It was right, it was immediately after we got the EKG. We were leading him from upright just a little bit back and he just went and done. Carlos immediately went, dropped. Carlos to start CPR. I mean, it was within a second of him going out that he had CPR.
We went up to provide a driver for him.
Yeah.
Me and Glenn, and we rotated out. Him, Glenn, Tanner, and myself rotated out,
So,
and it just was perfect. Just, every time there was a pause, it was like literally, someone was sitting there
respiratory
with
failure.
femoral artery,
Mhm.
feeling the
Is-
compressions. They'd stop compressions, just
Shallow elimination
check,
drugs or absent
no
blood
pulse.
cells.
Okay, resume
Resume
CPR.
CPR.
And it was the first time I'd had a guy, he was like reaching at us
Patient has
and
some
like
breathing,
looking
but not enough.
around because of, like, we still had
So that's
really
like
good
not
oxygenation to the
significant
brain,
for
but the
like
second we
respiratory
stopped,
failure.
he'd be
And then
back.
that's oxygen.
Like you start compressions,
That's the
he'd be like,
cerebral
whoa, whoa, whoa,
brain thing, yeah.
you'd stop and I was like, what the hell is going on here? Quality.
It's probably the best code I've seen, it's still. We had a lot.
Are you guys still recording?
Yeah, he's on.
You still there, Glenn? Yeah, I probably should have turned it
I'm still here, Jim.
on. Still there? Good. I need to figure out how to do source production. Well, luckily the microphone's already there, so we're just picking up all of it.
One, it's an Adobe
I didn't even look for trust.
program that I use for video editing.
Yeah.
I love it, it's called After Effects.
Oh, yeah, that's what I got.
It should be, it's.
The free version is still pretty good.
I paid for it, so I mean,
Yeah.
that's out.
I like After Effects. It's probably not the best program out there, but for like just cutting and like stitching things, I think it's a good program.
Okay, good. I'm pretty sure I have that.
There's another Adobe that's really good
Actually, you're right.
for, like,
This is
actual.
no different.
I don't know, when I was in high school.
It was, I had to read it like 3 times. The third time I got it out, yep.
Laser effect and have it traced. That was fun. And I did all that on After Effects.
I'm going for it.
No, there was one class that we sat in BS for an hour afterwards, and oh, yeah, I got to turn off the recorder. So I got to cut all that. We'll cut it all. Yeah, we're all out of, the good stuff we had downstairs.
I'll just throw another.
The hydration packs.
Oh. Let's try all the stuff left over from the. This is a little much, this side.
This is sugar and water?
Yeah.
Okay.
What are you, the alien from Men in Black?
Gotta keep the skin hydrated.
I do this at restaurants.
More.
If I get a glass of water, I'll
More.
put one of the sugar packets in, because you can barely taste it. When you do like one packet to a cup, I'll probably taste it. But
Yep.
That was the part you do.
I had a good time. But
I wish we had played poker, but
I got
You should have gotten up and started your own game of poker. I don't, can't even complain about it.
And I will. I'm going to.
Every single day.
For the next 12 months.
It's okay, I'll only be here for the next 6, so I won't care after that.
Well, then I'll double my efforts, so you get 12 months worth of it.
Gotta make up for it somehow.
The only thing that's still on there is,
I like it.
Is it 100%?
Oh, good, there's still a
You thought you were dead.
These are the ones that I
Seven?
hate.
No, I
To fill in the
haven't.
blanks?
Okay.
Yeah, they're fucking terrible. I thought most tests did away with these because
Our actual tests do not have any of these. Our actual tests are multiple choice. Yes.
we're trying to figure out how to start doing it the way National Registry's doing it now.
pick the right selection and not the wrong ones. That's it.
So,
That's right.
yeah.
Please
No,
tell me.
National Registry now is you arrive on scene, you see a 19-year-old
I'm okay
walking
with that.
around.
Good and trust
What are your steps? Put these
I trust
following
you.
steps in order.
Scene safety DSI.
Oh,
And it's, since they're not, National Registry no longer requires psychomotor exams.
which part?
Number 8, fumbling.
This is what these firefighters do.
Oh, Venturi mask? With,
Yes, this is.
mixed with
This test on the floor.
natural air.
It's got holes in the side.
Yeah, it's got,
That's because you have.
it's mixed with atmospheric oxygen.
So yeah, they're no longer doing
Same thing, whatever.
psychomotor skills.
Yeah,
So they're incorporating the psychomotor skills into the test. So now it's a order.
so it's a knowledge where you're taking from the skills test. Okay.
Yes. So basically, if you know the sheets, you should be all right.
Let me take it.
He's doing.
I love that style.
You love that, that's nice.
I have a feeling that firefighters in Massachusetts are not the smartest people.
We like to
You
have
know,
kids.
you know what always cracks me up is like that part of the country is notorious.
I don't know who is scared right now, me or you.
Not the best individuals in the world. And also having the highest concentration of
Highest concentration.
Ivy
of
League
call-
schools.
Ivy League and just call. It's like all over these folks.
because they're trying to import everybody else to raise the average IQ of the population. You ever
Kind of balance out somehow.
You ever listen to someone from Boston talk? Do you ever get the impression once that they're smart?
I love
I don't know, I saw, Matt Damon in that fucking movie, so it's gotta be something, right? What is
How do
that?
you like them apples?
that.
Oh, Goodwill
Ben
Hunting?
Affleck,
Yeah, Goodwill Hunting, thank you.
Ben Affleck, the accountant.
The
He's
account.
smart as hell in that movie.
Why you acting like you've never had a baby before?
He's playing a smart person. That doesn't make him smart.
Cause you're just like kind of just
Yeah,
hung
but you
out.
gotta admit, man,
Just
those
sound
guys
alike.
come up with their own screenplay while in college.
He's gonna just hang out.
And
He loves to
and
attack
the
people.
Academy Awards. I didn't realize how long they had been
Oh, get it,
acting.
girl. You're so close.
Prior to that.
You're so
And
close.
they go back to the teenage years. Hey Glenn, just in case you're confused on what we're doing, we're going over chapter 10's paperwork or whatchamacallit. Yeah, chapter 10's handouts.
Is it? I think, I could be wrong. What are the random letters for? Is this even actually relevant to the answer?
Ox? I don't think so.
What is it?
There's just 2 letters after this answer.
Yes.
Top question. Right after the one.
Sure. I'll see what I can do. Find me the coolest one. Because the only I'll have that. Send me some links.
Does it taste good?
Did you say so crunchy?
So crunchy.
Petroleum based. Yeah, I don't know what the
Oh, here's. I'm gonna start writing this.
See, like, why is this chapter 10 and primary assessment like chapter 14?
So,
Gotta teach all the steps for you assessment.
Then we learn assessment first.
so the reason we put assessment where it is so that you guys can get to writing. So in theory, the best way of teaching this class is to teach you path or
I'm sorry.
anatomy and physiology, what's the body made up of, pathophysiology, how things work inside the body. And then we lead you down pathophysiology, which is what we're doing now, respirations, bleeding, shock, stuff like that. And then we get into assessment, primary assessment, and how to assess the body. But in order to get you out on the trucks and being able to do some ride time, we got to put that stuff ahead of it. So we jump around a little bit on this.
One of the ideas behind that is you have to know what you're looking for before you can look for it. So teaching you how to assess somebody without knowing what it at all you're assessing for doesn't really work. Whereas if you understand all the processes of what needs to be looked for, what is normal, what's abnormal, and then we teach how you look for it, then it kind of clicks a little better.
Probably, I think, Monday, I think we're teaching respiratory emergencies. Yeah, so respiratory emergencies we'll be pulling out. The sim man will be doing a lot of listening to lung sounds and talking about stuff that way.
Do we have the dummies that actually have the chest rise and back properly?
Yeah, it's over there. He's our sim man. We do have actual CPR Americans that'll do it too.
Did your sim man come
I was
apart?
gonna say, if we don't wanna go
Did your
steal
sim man
something.
come apart?
Fine.
Oh, he does, but not, he's a full body sim man.
Do you guys find the answer for 9? Cause I can't.
What's
Okay,
question
cool.
for 9?
Under pressure, oxygen and oil do not mix, which is why delivery system or gauge should never be lubricated with blank blank.
Petroleum based.
Yanks.
Well, what happened is petroleum and oxygen will cause fire.
Is that what you're gonna put in here?
It's not cool.
This is just like, oh,
I
yeah.
did think I knew it.
Look at Jim.
Thought the booth was still on it. That? Thought the booth was still on it.
He goes over to town in the field.
You gotta be careful when you move. Just get-
Exhale.
Wait. This one? No, this one.
Doing his homework.
Do you think Sharon would accept that as an answer to me?
Yeah, my baby.
This thing?
The baby, he really was trying.
Can I take a picture?
Okay.
Crazy.
Almost like we suggested that.
I have so many pictures. I don't have my phone.
I feel that.
Yeah.
I'm at that point. It's when I hit this, is when my brain goes, time to stop.
What? That was not. Yeah, go hang out with the dudes. You don't go hang out with the dudes?
Yeah.
Probably doesn't. Fine.
That's why I took it away from him.
No, I'm just
Bree
saying.
told me to give them to you.
Okay.
Oh, you can come join.
11, it's High Constant Drive. It's on the page.
Where at? Oh,
Yeah,
Scroll upside down?
I was gonna say, I lost it now, it's on the page.
The dog might be ripping it or something.
Yeah, keep this thing apart, if we do the ones with the, or. Oh, you're telling me to sit down.
No.
I thought he was being like, sit down. Alrighty.
Oh.
Oh. Still somewhere. There you go. Oh, when you push down, it releases it back out. I like that.
Yeah, so these mannequins are getting pressurized.
I guess we're doing 2 breaths for CPR that way. And the other time we blow it up.
Dividing by the flow
If we get our new mannequins. Seen a new, the press set and CPR mannequins. They got lights here that light up when you're doing correct depth and release.
Yeah, that's what we have. I didn't know that was new though.
Oh, they're the newest one, the 2000. You can hook it up to an app on the phone.
Oh,
And it'll show you feedback.
yeah, we have the one that has lights up here. I think it has lights up here and.
Thank you for telling me how bad I am at reading a piece of paper.
There's one.
Yeah.
Oh.
Not really.
As well as I do.
Some signs of inadequate breathing. I can remember at least 8 that we've talked about today.
They talk about stomas at all. They talk about stomas at all.
Oh, anyways.
Yeah, but really should have looked over this. I really should have used the book though. I'll follow the book a little bit more. Should have grabbed it from Sheriff. I was up here a month ago.
We've had it where the information has updated so much in the book that the students are correcting the instructors.
Are wrong.
Yeah.
Yeah, my class, perfect.
Yeah, some of the instructors take it and go, oh, that's new. Others argue with it.
Two, no.
What's up?
Number two,
Number, which part?
oh, sorry, long writing one. List the 4 principal procedures used in treating life-threatening respiratory problems.
Pretty good. 4 principal procedures. So what's the first thing we're gonna do to take care of anybody with a breathing problem?
Up eight and airway.
What's up? Not the first thing.
Sure, up eight and airway.
Yeah, we're gonna make sure that they can maintain their own airway. So we're gonna position them, right?
Yeah.
So we're gonna maintain an open airway or patent, as he said. What's next? You're like, that's step 3. Because we want to give them the least invasive and then work our way up, right? So how do we give them the least invasive? Positioning is going to do that. What's that? He's mad because of both of them. What's next? So positioning and what? Then oxygen?
No. Then ventilation, I'm trying, or, well, I guess respiratory rate. Wait, hang on, I don't even know what I'm trying to say. Let me form the things in my head.
Positioning or the patent airway, would that include like position of comfort?
Yeah.
So if nothing is improving, then you would administer oxygen.
So this is talking respiratory problems though. So if patient level of comfort is just sitting there, that they have called us. We need more help. So what else can we do more? So before we provide supplemental oxygen, we can do what? No, just respirations. What can we give them? What can we specifically do for them before we start hooking them up to a bunch of oxygen?
Will that be positioning?
That would be position. Like for his eyebrows. So we've got position of comfort, artificial respiration, or ventilation. We're gonna try and help them breathe before we try and add a drug to them. Because oxygen is a drug.
In my mind, I was thinking, oh, your O2 is down because respiratory. Let's try a little bit of an oxygen and see if that helps improve. If it doesn't, then maybe artificial ventilation, because I feel like that might lead to be more.
Okay, so let's think of it this way. The oxygen we give them in that bottle, is that healthy for them?
Not technically, no.
Not technically, no. Why?
It's not atmospheric air.
It's 100% O2. What is atmospheric oxygen? 21%. What's the rest of what we breathe?
Yes. Yes.
Yeah, nitrogen. There's a bunch of other like argon, neon, radon.
Yeah.
That other 1% bullshit, right? That's extra crap.
Nicotine.
Yeah, I'm sure there's a lot of smoke in you. What's up?
He's looking, but my thought process on says if we have 4 things, would be, like you said, positioning, but then coaching would be the second.
Okay.
It's like coaching them on like slowing breaths versus maybe taking deeper breaths.
Yeah.
Then oxygenation and then artificial ventilation.
Okay, I can see an argument for that. And I don't know the bookend. But I'm telling you the right steps in my mind, the least invasive, that is a drug that is actually toxic. That is dangerous to us. So putting someone just on supplemental oxygen, what are we doing to their heart and their brain? We're changing internal functions. We're just messing with them just by, hey, you're at 92, but you look fucked up. I'm just gonna do that. They might need help actually getting the air in instead. So I go from outside, pushing inside, adding to the inside, and then more stuff.
Okay.
Does that make sense?
Yeah, so pavement airway, artificial ventilation, oxygen therapy.
Yeah.
And then.
Oh, it's cool.
Well, that's why, like, if I had a fourth, it'd be coaching.
Coaching.
I know we've done that quite a bit.
So, the question is for life-threatening respiratory problems, correct?
Yes.
So positioning, oxygen, airway adjuncts.
Adjuncts.
So,
Now,
now, I'm not sure that's what it is, that's why I'm looking it up, so.
What's a stoma breather?
It's for
It's
people with a hole in their throat.
Oh, when they come to-
it is the whole.
It is, the stoma is the hole. So they have a plug, so they've had issues with mouth or oropharynx, their epiglottis or their tracheal opening. They've had some reason to have a stoma, please. What's the question? Because I didn't talk about
Always
it at all.
position,
Always-
it's true or false? Always position the airway of the stoma breather prior to providing ventilations.
Position the air, what is?
Position the airway of a stoma breather prior to providing ventilations.
Yeah.
You position anybody before.
So think about where the stoma is.
Yeah.
Stoma's gonna be right here,
Oh, so yeah, they obviously they can breathe.
so. This is where it's really important to keep that airway open in a stenting position. Because any movement down is gonna take that flap and close it.
And this is how I get ready for it.
That's a terrible commercial.
Can you use a pediatric bag valve mask to cover a stoma?
You can, you absolutely should.
I don't really think
Yes, I agree with that.
this would be a very
And then-
difficult mask. Yeah, to seal on stone.
You know, I'm thinking about it, I was talking a bunch of shit about Boston. Some of my favorite comedians are from Boston.
Bill Burr.
Yeah, Bill Burr's fantastic.
Dennis Leary.
Yeah. Oh,
Yeah, he's from Worcester.
Boston.
Still
and
not-
Jersey.
Boston
and
major,
Jersey.
whatever,
Boston proud of.
proper.
As it is.
That's really,
Well, we just
I
talked
know,
about
because
that.
everything else that you just come out and say it, it's like exactly how it's worded.
I'm gonna apologize to you guys now, because I did not look at the test beforehand. I hate teaching stuff directly from a test. I probably should have looked over it and done more looking through the book to find out, to hit more of these questions.
Okay, that's
So,
fine.
my bad.
Yeah, you're okay. I don't think.
You're gonna be better next time.
I'm gonna be better next time. This is actually my first time.
I hope he gets featured the teacher class again,
Couldn't you
honestly.
technically
Yeah.
just take the mask off of the BVM and hook it straight to the?
Oh, yeah.
I don't think the.
but so a lot of stomas have, well, let me take that back. There are people with tracheostomies that have a tube in their throat already. is hooked up to a ventilator. Not all the people with stomas have that. So these are people that have a tracheostomy that they're ventilator dependent on. They get a mucus plug in, they take it off, bag them, or you suction that mucus plug in.
I don't think that's what kind of EMT script, is it?
It's, cause you're not actually tubing, you're ventilating through a tube, so it's no different than ventilating through it.
I thought that was a high skill.
Yeah, I thought it was a high skill. I thought that, I don't think basics can do that. They can't.
I don't know, I have basics, augmentations all the time.
Yeah, I basics do a lot of stuff, but
Questions all the time.
I also make them give, hey, you're gonna do this albuterol treatment. They definitely shouldn't be doing that.
Business condition, adequate,
Yeah, just because we done it doesn't make it right. Just go to the state page, look at the scope.
It's like, yes, but it's very good.
What is? Which one?
16. When ventilating the patient with a bag valve mask attached to an endotracheal tube, the EMT must always be conscious to observe and report any changes in the resistance while
What?
No, go ahead.
No, I was
You have
gonna,
something to say?
I was actually gonna, what, yeah, I was actually gonna demonstrate, but changes. Why would I suddenly have changes?
Like a resistance?
Through an ET tube, through something going on? What could be happening in it? Blockage. Blockage, that is a great one, yeah. Blockage, disconnection, dislodgement. There's actually a whole acronym built just around ET tubes. There's so much shit that can go wrong with them that anytime you feel something different, just assume something's wrong. Should I think the last time I tubed somebody Teague was here?
I had more tubes as a firefighter last year than I did as a paramedic.
That wouldn't
on the
surprise me.
ambulance.
I've been saying for years, but for the past 2 years, I've had more experiences in EMT than in the department.
What?
I'm just reading this question and debating.
Bouncing back and forth?
Before I go and look it up, see if I can. Cause it's a 50-50, I either get it wrong or I get it right.
Yeah, true, false.
So according to Quizlet, it's open and maintain the airway, provide artificial ventilation for non-breathing patients or the patient with inadequate breathing, provide supplemental oxygen to breathing patients,
3 for 3. Okay.
assure airway clear with frequent suctioning as needed.
Suction. Ooh, we did not talk about suction. So the last one on that 4. So you guys hear that?
Position,
I heard
ventilate.
it, and I'm going back to change it.
Yeah. Position, artificial ventilation, supplemental oxygen, suction. Man, 3 for 4. Fucking had it.
The mask one.
75% is not a passing grade in this class.
So it could be a
Yeah.
pocket mask or it could be one of those
Like
barriers.
One-way filter
Are
ones.
you
Yeah.
guys ready to go?
I got like one question left.
Oh, shit.
So I guess technically yes.
Yeah. So like I said, I do not look at the test. mostly because I don't like teaching from tests and I hate people to do that. I want you guys to think through this shit, and actually understand it instead of just knowing how to take a test. Because I think you'll do better on the test if you understand the process instead of memorizing answers. All right, first page, what you got?
B. The reduction of breathing to the point where oxygen intake or ventilation removal of carbon dioxide is insufficient to support life is called respiratory failure.
Is it insufficient to support life? Is that arrest?
No.
What is that?
Failure. Failure.
No, like when is it arrest?
When they stop breathing.
They stop, they're done. When it's insufficient, it's just not enough. That's the difference, okay? Two.
Signs of inadequate breathing include wheezing, yawning, or gurgling noises. Diagnosis of the lip, earlobe, or nail beds, and the patient being unable to speak.
So you guys understand all of that is a problem. It's really cool, you'll see earlobes on babies. So that's, I like to throw some weird ones in there, so that's good. 3.
A 45-year-old is suffering from an acute asthma attack. You expect the patient to have a decreased tidal volume.
Why decreased? So dead space is what? Where is that located?
Your mouth,
Your upper airway.
Thank you, upper airway. So you guys are all right. You're all describing it saying the exact same way or different ways. You're all right. Upper airway. Where does asthma affect us? So decreased. So you look at how that works to decrease that space and that inner volume. That's the problem, because it's limiting that hole that we have. Okay. You guys don't have to read the questions. So
A.
A. It's a discussion based talk. B. Oh, fight to the death.
Nope, I thought we were just moving on.
not fight to death, sorry.
No, oh,
4
come
is
on.
A.
4 is A. Did anybody get anything different?
No.
Negative. It does.
Most effective, 2 rescuer. Yeah, it's always going to be better to have 2 people doing that. Is it actually legitimate for that to happen? Never. So you're 100% right. The test answer is a 5. B. Why is it B?
Because if the patient's color is so blue or gray, there's obviously not enough.
Right, so if they're adequately breathing, if their heart rate returns to normal, and they're rising and falling with each breath, those are all normal things. That is normal function. So that is exactly what we should be having. The only one that is out and that is terrible is B. Okay, 6. C. Pocket face mask. Yeah, 15 is actually like the highest that most O2 or O2 things would do.
Yeah, so pretty much anymore,
15, just crank it up.
for test answers, look for 10 to 15. For a, well, let's see. Let me make sure. Never mind.
I like they store that
The
B.
same
Yeah, it was 15.
principles in the book. I couldn't find it in the book, so I followed the same principles as the non-rebreather. It said 12 to 15.
Yeah, I misread it, so, yeah, 15 is on a pocket mask.
7. D. Sure. 8. A. This, what's the rest of it? They're all perfectly normal. You should. What's that?
That's answer, so sure.
Yeah, I mean, they're all, yeah. 9. Good. 10. C. Y.
You're not supposed to use the cannula at a child under 1.
Why not chronic lung disease or home oxygen system? Or wait, you guys said B, right?
Oxygen system, it's probably
You
not
said C.
sufficient for them at that point in time if they're still having problems.
Nice way to think through it. That's perfect. Okay. So what did you say?
You said C.
Yeah, will not tolerate a non-rebreather. Yeah. So D, they're probably using a cannula already with a home oxygen system, and it's not working. So that means it's not enough. They need more. They need all of it. So hit them with something else bigger. That's what rules those, we want to rule these answers out by thinking through this stuff, okay? So 11. See? Sure.
He's holding him like he's comfortable. You were holding him.
Cause
like
babies
you're
make
scared.
me uncomfortable.
Why? What's wrong with this?
He's holding him like a father.
12. C. Sure. Insufficiency, no 13. Gotta retouch that so much. I hope you guys got that.
Hey.
A. All right. Long ass question. Case study. No kind of a case study. It's really short. But sure.
Yeah, how in detail do you want to go over this?
The whole thing. Run me through the scenario. Because that will hit all of our questions.
Jeff Casey.
A heavy rain is running off the ambulance
No,
windshield.
no. The questions. We don't need to read that.
You said it
No. I want to run through the whole scenario of
After
treatment for the patient because that will answer all of the questions.
Oh,
So
okay. So
he goes down. What do? We start CPR, right? Because why?
he's
Not breathing.
Unresponsive. When they go unresponsive,
I figured you would. He was tweeting.
you got the face for it. When they go unresponsive, what do? We start CPR. So how does that change our treatment for his airway? Oh, Jerusalem.
Just catch like that.
Yeah, I think it's right here. Is it green? No, that's a pill or something.
That would be the advent that I lost what yesterday.
Oh, yeah.
Wow, okay.
I
Cool.
was stuck on my way out.
You really do have bad eyesight. Yeah.
I told you.
Okay. All right, so we start CPR. What is involved in CPR?
Artificial ventilation.
Artificial ventilation. So it says on 3, discover that the BVM is missing. Oh shit. Pocket mask. Hopefully you all call ALS. You absolutely should be calling for help. If you guys are both EMT basics together, you should be calling ALS. Yes.
Before the pocket mask.
Yeah, as soon as that happens, be like, oh shit. More help. More hands are always great. So he goes down. Absolutely. Call for additional resources. How far down in the actual assessment is that? You guys did the assessment already, didn't you?
Yeah.
How far down is it?
At the beginning, yeah, pretty.
It is. For the first 5 steps. Everybody knows the first one. Scene safety.
General impression.
General impression. Then what?
PSI, sensei,
PPE.
how many patients do you have?
That's for PSI.
Call for ALS.
Mechanism
Oh, yeah.
and call for ALS.
Spinal immobile.
Something like that.
There you go.
C-spine.
Okay.
Considered.
So you guys are knocking through this scene and you see this guy all of a sudden struggling to breathe and he goes down. Your scene assessment has changed. You are now at like, oh fuck, time to call for more help. You will call fire, you will call paramedics, and you will get 30 people on scene. That is what you're supposed to do. So here for 3, when you notice that it's missing, what can you do in the meantime?
Artificial ventilation.
Pocket mask, what else can you use? If we have a filter, I'm not putting my mouth on this guy. There we go. 4.
Gastric distension.
Yeah.
Hyperventilation and rapid BP. And decrease in cardiac.
Can you measure cardiac output?
Well,
You know how? So heart rate, blood pressure, factor in the cardiac output. I don't expect you to know that.
You said it like
You
you
can.
sure as hell
You can.
expected me
I'm
to
saying
know
you
it.
can. You shouldn't know that. Okay? That's Jim, me.
Actually, you shouldn't.
It's a lot of math to do on scene while you're trying to beat on someone's heart. I'm not even
It
gonna do
should
it that
give
way.
you, if you have a funky little machine like ours, it gives you the map. It gives you a rough estimate.
Gives you a start towards measuring cardiac output. Cardiac output is the amount of blood that pumps around your body. So that's a base way to say it. All right, number 1,
respiratory distress.
respiratory distress. Why is that not respiratory failure?
Number 2 is respiratory.
That's what our book says. That's what the statement said in the book. All right, how do we know number 1 is just distress.
It's inadequate breathing, not.
Actually, it calls it.
Well,
So you're on
You
here.
gotta read the whole
Could-
question.
yeah,
So a
could
person who is
you-
already showing
damn
signs
it, we shouldn't erase it.
is at
Yeah, I
risk
just
of
wrote
going
it out,
into,
not-
they're already in distress, they're at risk for going into failure.
I was not trusting the fact that it was 2 respiratory failures in a row though, so.
That's
Yeah.
what I was at, cause I
That's
wrote,
what tripped me up too.
Distress is like you're running and you're out of breath.
That's
Who
why.
Who said they were walking up the stairs and had a hard time? Was that you? Yeah, you
No.
were in respiratory distress. That's the level of respiratory distress. Inadequate
So every second of
breathing
my life.
is when you're in failure. Inadequate. It's the same thing as insufficient. So respiratory failure, number 2 is failure going into respiratory arrest. Because it says when breathing stops.
It just tricked us because it's a.
Yeah, that was very
respiratory
weird.
failure
Yeah.
twice.
So they did failure, arrest. Remember, like I said, babies will spend a long time in respiratory distress. They will go through failure very quickly and then go to arrest.
Well, why wouldn't one be arrest? Because if they're already having
So-
inadequate breathing, they're already in.
because arrest is the absence of breathing.
Yes, arrest is stopped, like you're done breathing. You are not breathing.
So,
Failure just means you're struggling to breathe.
yeah, so
Distress
like-
means, hey, my lungs just need to catch
Yeah,
up with the
but
rest of my body.
inadequate breathing, you're still breathing, you're just not breathing enough to live. This would be failure.
so
No.
yeah, so
So
Failure is
let's,
no breathing
let's
at
take
all.
the,
No,
going up,
arrest is no breathing at all.
Yeah.
let's go with the running example. I just get done running, I'm breathing. It's fast, it's hyperventilating. Is that adequate breathing? That's inadequate breathing, but it's not to the point of failure. Failure is where I'm using it, like agonal type, I'm using accessory muscles, I'm just like breathing a little heavy. That's inadequate because I have the ventilation.
and it's also, well, just for a wording. on
It
it.
is-
I'm just
While-
gonna say, the book
While
did,
he's running,
the book
his
did,
body is not getting enough air to maintain status quo. Okay, so normal, he's not getting enough. So now he's outside of normal limits. Right there where we have outside normal limits, he's in respiratory failure. Remember, because the stress, hey, you're struggling, you're trying, but you're still pretty close to being normal. Failure, you need help. Arrest, you're done.
so
Okay,
distress,
I was just thinking of inadequate as
It's
inadequate to support life.
yeah, and that's,
I also.
it is pretty close to being that. Inadequate to support things, it just says inadequate to breathing. So inadequate in this case is insufficient, which those two being done together, because another question had insufficient breathing, and it was the same answer. So insufficient, just, it's not quite there.
What I don't like about the wording is, so what's normal respiratory rate? 12 to 20. What's inadequate breathing?
Anything above or below.
So anything below 10
Oh, yeah. and book one.
and above 24 is inadequate breathing. So when you look at that, normal breathing is 12, you got 2, and then anything below 10 is inadequate. Anything above 24 is inadequate. Do we see that quite a bit in distress in real life? Yeah, we do. Especially above the 24. It just gets, the wording of it is just sucks.
It does. And like, it just says inadequate, that's just barely. Think of it being like, it's just okay. It's not great, oh, it's just okay.
One way to think
Right.
about it is think outside of respiratory issues. Someone who's having an anxiety attack, who's hyperventilating, they are not getting enough oxygen, but they're not in respiratory failure.
Okay.
That would definitely be respiratory distress if they were breathing like 32 times a minute. They're
Yeah,
gonna end up
I
probably
get it.
passing out from it
Yeah.
This.
because it's inadequate, but not because it's
Okay.
failing.
All right. So everybody got it. 1 and 2 are failure, but 2 has the respiratory arrest. So you got it. Remember, distress, failure, arrest. Because they couldn't put 2 rests next to each other. 3,
Look, listen, feel.
look, listen, feel. How do we do that?
Look for trust. Use your eyes, ears, and.
Yeah.
That's perfect answer.
Yeah, that's,
Good
hey, that's
boy.
right. You're not wrong, but you're not right.
It used to be, no, actually, yeah, you're right. So it used to be that you would put your head right down next to the mouth and you would check for a pulse, you would look and you'd feel the breath on the side of your face. The problem is people shoot.
I still do that.
So that's where it's going is right there and what's right here.
Mouth perfect.
So now to look, listen and feel, you're looking with your eyes and you're feeling, you really don't look, feel anymore. You just now listen. You listen for air going in and out of their lungs and you're looking for chest rise. So want to get down right next to their face.
Yeah, you can do it.
Before.
All right, 4. Why is it cyanosis? Because cyan is blue. That's just the medical term for, hey, they're turning blue. Because everything's got to be harder and they're different.
I think maybe the cyanide is blue.
Yeah, isn't it? I don't know, I've never seen cyanide. I know it's a white powder when you break it down, but
It's a lot.
the liquid itself is like light green, but I wonder if like the flower blue or something.
Because we use
Yeah, it's
that.
blue.
I know, Mike, I just use blue though.
So 5.
Bluosis.
Mask soon.
5, mass seal, okay. 6, pop off valve. Sure. BBM systems can deliver nearly 100%. Why does it say nearly? Are we ever giving 100%?
Nothing's perfect.
Nothing's perfect. So that thing right there, maybe pressurized oxygen, but we're still not getting 100% seal. We're still not getting 100% oxygen out of that. So always say 99%. Venturi mask. What is the difference? What is a weird looking mask?
It's got holes in it.
Yeah, it's got weird ass holes in the side. So it mixes with atmospheric oxygen to even change the pressure, or not the pressure, the oxygen concentration.
This is the right answer is inhaled air. So it's again.
Yeah, it's mixing in with atmospheric air to, instead of go for 99%, you're getting
Just
same thing. Atmospheric, inhaled, room, they all mean the same thing, just, yeah, regular. All right, number 9. Petroleum-based lubricants. Yeah, what do we gotta use? What's that?
Take an oxygen canister and blast it over some motor oil or.
See what happens.
Yeah.
I thought we were supposed to use a water-based lubricant.
Because petroleum and oxygen become.
There's something funny with silicone too. I can't remember what happened there, but
So everybody's heard you don't smoke with oxygen.
Yeah.
If you were to just take like that oxygen tank and open it and take a lighter and then poof, nothing's gonna happen. 'Cause it's actually too rich. The reason you don't mix with the petroleum is the petroleum starts and maintains that reaction. And then you have the oxygen. That's why if you've ever seen an oxygen tube, like a nasal cannula catch fire, it's just like huge flames that burn and like it's crazy. The fire smoke.
okay, number 10.
Exhale there.
Exhaled air. Yeah. That's what the partial rebreather, it's just slightly different than Venturi. It's got more of an open. It's just really just plastic outline. 11. Okay, perfect. We talked about that. Nice catch. We finally didn't have to look at it. So hypoxic drive, they live in that low oxygen state, that higher CO2 state. Okay, 12. Cool. There's really no argument. 13.
Gauge pressure and flow rate.
Sure. Sweet. Number 1.
Mental status.
AMS. You're never wrong. Somebody else.
Abdominal breathing. Cyanosis.
You missed the somebody else choice, buddy.
Oh,
Nasal flaring,
Nasal flaring.
noisy breathing. Slow pulse rate.
Slow pulse rate. Fast pulse rate. What's that? What kind of compensation? That's what we're going over.
Accessory breathing,
Accessory, what accessories?
accessory muscle,
Like what?
Your,
shoulders,
uh,
Intercostals?
depth.
Throat. Yeah, you'll see even the collarbones going in. Okay, Two.
So,
yeah.
Positioning,
Positioning. What we decided number 2 was?
artificial ventilation.
One's patent airway. So 1, we're gonna open and maintain a patent airway. 2, artificial ventilations. 3, supplemental oxygen. 4, suction. Remember, we had the conversation, you went back and found it, you just didn't go back and change it.
Like you said, I'm not gonna go back.
I'm not gonna go back and change it. Number 1,
True.
2, 3,
True.
4.
Sure.
Yeah, blue, gray, okay. 5. Oh, sorry, I lost my spot here. 6.
also,
This was 5, true. That was false.
A non-breather mask with high oxygen concentration is the best treatment for a non-breathing patient.
EM would be the best.
Yeah,
If someone's in,
really need ventilation.
Yeah, they need artificial ventilation.
Oh, I see.
We not say false for that one? Did I hear that?
I said false.
Oh, I'm sorry, I thought everybody said false.
One person said false and
Oh.
one person said true,
Yeah.
the rest in there.
5 is false. Definitely false. So let me get back to it.
That's right.
we're on 7.
No. 6.
6
False.
false.
False. Yeah. 7.
True. Yeah.
Yeah, it sucks. 8. True. 9. True. 10. False. We should ventilate them, artificial ventilate them at 10 to 12. Every
Oh,
5 to 6
that's-
seconds.
True, yeah.
That is true. Every 5 to 6 seconds for breathing. That's taught in BLS and in SPECS. Normal breathing when you're awake is 12 to 20. We don't artificially ventilate them at that same rate. And part of that is because we're delivering high concentration oxygen. 11. 12. 2. 13.
I'm still turning the page. Yeah, so.
13.
True.
Okay. 14.
True.
15. 16. 17.
False.
Cool. Any questions about this? None, hearing none? Nope. See, bye.
By the way,
Holy shit.
when you're
Damn it.
defibrillating a patient, most time you're just gonna lay the bag on the patient. You know what that. But
All right, ready to go back tomorrow?
don't be touching anything once you get shot.
My favorite dog outside.
I'm really gonna turn that.
All right, Glenn, if you're still there, we're done.
Yeah, it looks real.
That's brand new.
Oh, baby.
So,
Okay, thanks, Jim.
on Saturday,
All right,
at the library?
you have a good night.
You guys want me to stop by scooters? Would love, yeah, I'd love that.